Good morning, everybody. Thank you for joining us again today. For those of you that were here last week, and if we have any new people joining us, thank you so much. We're going to just give it a little bit of time to let people sign on. We had over 300 people register for these sessions, and so we're expecting some high numbers again today. But hope you're all having a nice morning. It's a beautiful morning here in Roseville. Don't know what it's like in the other parts of the city because yesterday when I drove from Roseville to Davis, I hit this huge cloud bank, and I'll have to say it was a little creepy going over the Sacramento River on the 5 and the Yolo bypass because I couldn't see anything below me. It was like an abyss. Anyway, still kind of cool. I love weather. So we'll just give it a few more minutes. Numbers keep climbing, and I anticipate a lot of people will be joining us. We will take a break. Garen will set a break for us at some point, probably in the next hour and 20 minutes, just so you know. And we're going to use the Q&A function today for all questions, because if we use chat and Q&A, we're going back and forth and try not to miss anything. But we will be holding all questions to the end. And we will be looking at the Q&A if there's links or something that we need to send off or send in there, we'll do that. Also, just as a reminder, hopefully you all received the information from last week's session. I sent it out on, I believe, Wednesday afternoon. If you didn't receive it, please send us an email at retireecenter@ucdavis.edu. Thinking all those thumbs ups I'm seeing means most of you received it. But it included the PowerPoint, some links, and the recording of last week's session. So, all right. Well, I think it's just time to get started. So once again, we're going to be using Q&A today completely, no chat. So put your questions in there and we'll get to those at the end. I want to introduce my Assistant Director, Amanda Seda here. She does an amazing job at the Retiree Center. Our program coordinator, Larry Tao, is out on baby bonding right now, so he's not with us today. He's having a lot of fun at home. Sudesh Prasad is with us also today,
Good
and
morning,
he
everyone.
yeah, he works with the benefits office too, and he's a great resource for us when we have some unusual retirement questions. We'll send them over to Sudesh. And then we've got Garen and Nick Robledo from Benefits, and they are rock stars of the healthcare world for UC Davis. So I'm just going to say a couple words and I'm going to turn it over to Garen. So Garen Solbach has, I'm sure many of you have heard his name and probably spoke with him at some time throughout your career. He has been with UC Davis a really, really long time. He's also an alum, so he sort of bleeds UC Davis, right? Anyway, but he's going to give us a great presentation, and something I just everybody should know is like the Retiree Center, we're here for people that are still employed if they have questions or they just don't know where to go to ask the questions. We are your resource. But then in retirement, we also become your home, right? Because you're no longer an employee, so the retiree center is sort of your home base. Garen and Nick are here for you, as well as Sudesh, as an employee and in retirement. So you don't lose any of that. And so just keep that in mind. With that, Garen, Nick, thank you both for being here. I know this is going to be a great presentation, and every single year I learn something new. So I'm going to turn it over to Garen. Thank you so much.
Good morning, everybody. Thank you to Julianne. Thank you to the Retiree Center that organizes these presentations and keeps us connected to everybody. I really appreciate the partnership we have with the Retiree Center because I no longer have to advertise for our presentations. The Retiree Center does it for us. So I really appreciate them. And good morning, everybody. I hope you didn't have to drive anywhere today. It might have been nice in Roseville, but it's whiteout conditions in Davis-Dixon, and it's really, really soupy, really hard to drive in. Anyway, my name is Garen Stolbach. I'm a healthcare facilitator for UC Davis for 22 years, the last 22 years, something like that. Nick Robledo and I are the two people at UC Davis who specialize in health insurance for active employees and retirees. We specialize in troubleshooting the plans, and we specialize in Medicare enrollment and coordination for employees and retirees. And we're going to try to share some of that information that we've gleaned over the years with you today so that you are better prepared for your retirement or retirement planning. As we go through the presentation, Julianne mentioned the Q&A. Feel free to use the Q&A, but Nick is going to be monitoring the Q&A for me. And if there's a question that really would be better answered to everybody at once by me at the end, when we answer Q&A at the end, he's going to save that question for the end. So don't feel like you're being neglected if you have a question that you posed that has not been answered during the presentation. We'll get to it at the end, theoretically. Also, you might want to try not to make the questions too specific to your particular situation because we don't have your data pulled up. We don't have your UC Path record. We don't have your UC retiree database information in front of us. So try to keep the questions general if you can. If you have detailed questions for us, the best way to reach Nick and I is by phone. So give us a call, okay? Call us. We'll take email, but if you send us an email, please include your phone number so we can call you back because the healthcare questions that we get are often way too complex for a quick, easy email. A lot of times we need to talk things out. So I want to encourage you to call us. Just don't call us today because we're presenting this morning for the staff and in the afternoon for the faculty. So we're going to be tied up today. But next week, give us a call. Don't forget Monday's a holiday. Congrats. Woohoo. We have a 3-day weekend this weekend. But anyway, let's go ahead and get started with the presentation. Let's talk about what we're going to talk about today. First of all, we are going to answer all of the following questions. For example, which health and welfare benefits can you continue into retirement? And if you look at UCNet, they'll call it health and home benefits. Lately, they've changed the term a little bit. But we're going to talk about the health and welfare benefits that you can continue. We're going to talk about what it takes to be eligible for retiree health coverage, how much service credit you need, how old do you need to be if that's an issue, that kind of thing. We'll talk about how much you'll have to pay, not just for UC coverage, but for Medicare. And we'll have a whole section about Medicare because Medicare is not a simple topic, but Medicare, it's very, very valuable. And it massively improves our benefits and our ability to offer retiree health insurance. So we're going to spend a good amount of time on Medicare. If you don't, if you're not 65 yet and you find that boring, just understand it's coming eventually. Someday you'll turn 65 and be able to take advantage of all the taxes you've paid for Medicare. I want to address something up front. Is UC planning to cancel retiree health insurance? No, UC is not. But we're going to talk a little bit more about the future at the end of the presentation. And something else we're going to touch on at the end is specifically for those of you who might be retiring on July 1st. As you may know, July 1st is the most popular time to retire for UC employees, especially those who are in the 1976 tier. And we'll talk about why that is. If you're not in the 1976 tier, it doesn't really matter. But if you are in the 1976 tier, which many of us are, July 1st is a popular time to retire. So we're going to have a slide that specifically addresses the 7-1 retirees coming up. So let's get into the health and welfare benefits, the health and home benefits, if you will, that retirees can continue after they terminate employment and start getting a pension from UC. Well, first of all, you can continue medical, dental, and legal into retirement if you've met the service credit and age requirements. Okay. Now, I know this is titled health benefits and I've included the legal plan here, but there's a reason for that. There are 3 premiums that can be deducted from UC pensions: medical, dental, legal. Those are the 3 that can be deducted from your pension when you are retired. None of the other plans can have deductions that come out of your pension check. You can't contribute to an HSA from your pension check. You can't pay for your pet insurance from a pension check, that kind of thing. For example, Vision Service Plan. you need to pay VSP directly. And it's a little awkward to sign up for VSP as you retire. You know, medical, dental, legal, those are essentially automatic as you retire. As long as you don't tell the UC Raise system that you don't want the coverage, they continue. But Vision Service Plan requires some extra manual intervention for you if you want to keep it up into retirement, because you need to set up direct payment with VSP, some automatic charge to a credit card or a checking account or something like that. But it's a little awkward to sign up for when you retire because you don't know when you're going to get the letter that you need from VSP that will allow you to sign up for UC Retiree VSP. So because you're not going to know when you're going to get that letter, I'm going to encourage you to just use open enrollment. Every fall, there's an open enrollment. It's the same for employees and retirees, so you're used to having an annual opportunity in the fall to make changes to your benefits. Well, make a note in your calendar for Halloween or some other day that's at the end of October that says, reminder to enroll in Vision Service Plan, because it's easier to sign up during open enrollment than it is as you retire. Why? Because you have to wait for this letter, and you're not going to get this letter from VSP until after you retire, and you're not going to get it until after the RASC notifies VSP, and it takes a while. We don't know when you're going to get this letter. So maybe don't need the letter. Maybe get your, let's say you're a July 1 retiree, maybe get your eye exams and glasses done before July 31st when your UC Davis coverage runs out. As you may know, UC pays for an extra month of coverage when you retire. So if you retire July 1st, your coverage doesn't actually end until July 31st. So that means if you're a July 1 retiree, you have until the end of July to get you and your family's eye exams taken care of so that you don't need VSP until 2027, and you could just use open enrollment for that. Now, I want to give a heads up to those who have Kaiser. Kaiser provides an eyewear allowance of $150 every 24 months for members who have Medicare. So if you have Kaiser Senior Advantage as a retiree, you're going to get $150 off glasses and contacts every 2 years. Having said that, people tell me that Kaiser's glasses are still expensive even when they're 150 off. So you may still want to buy a Vision Service Plan, but I want to give you a heads up just in case you're thinking about how important is VSP to me. Is it worth it? It's $12 or $13 for a single person. It's, I think, $24 a month for 2 people. It's not expensive to have VSP if you want it. But now you know if you're a Kaiser member. So let's talk about the premiums that you can deduct from your UC pension check and how you see those premiums and how you see your direct deposit statements when you retire. Well, you're going to do that all through the UC Raise portal. And as you may know, UC Raise stands for University of California Retirement at Your Service, right? So that's what UC Raise is. That's going to be the portal that you use, not UC Path. You're going to use UC Raise to see your direct deposit statements. You're going to download your 1099-Rs, which are like your W-2s for retirees for when you do your taxes. You can use it to update your contact information, designate beneficiaries, make open enrollment changes, etc. Remember, you're going to use UC Raise, not UC Path. I will say, though, that you will need UC Path after you retire for that last W-2 statement so that you can do your taxes. So make sure you have a personal email address on file with UC Path so that you can get in to UC Path after you retire that one last. You do that, you're going to go to the UC Path website and you're not going to choose UC Davis employee. You're going to choose former employee. Former employees is what you're going to need to click on to get into UC Path for that W-2. But back to UC Raise. Let's say you're retired and you take a look at your direct deposit statement. You're going to see some weird abbreviations and acronyms. And I want to tell you right now some things. I want to translate some of it for you so that you are not thoroughly confused like most people are when they look at these statements, because they are not formatted in an easy to understand way. When you look at your deductions and contributions, all the deductions and contributions on these pension check direct deposit statements, they're all in the same box, okay? Just because it's in the same box as a deduction doesn't mean it's a deduction. It could be a UC contribution. And the way you're going to tell these apart is with the following coding. If you see a number that appears to have been deducted from your pension check that is labeled Med MBR Preem. Med means medical, MBR means member. It means retiree, it means you. Preem means, or Prem means premium. So it's your medical member premium, it's your retiree premium. This is the amount that is deducted from your pension check. If you see Med ER Preem, ER means employer. The employer is UC, former employer is what it should say, of course. But ER means employer, which means UC. So this is the amount that's deducted from your pension check. So if you were expecting to pay $100 a month and you see $1,000 a month, look to see whether it says member or employer, because member is what you pay, employer is what you see as contributing to the medical plan so that you can be enrolled. That did not, if it's an employer premium, if it's a UC deduction, a UC contribution, I should say, that is not being deducted from your pension check. It just looks like it's being deducted from your pension check because, again, it's in the same box on your direct deposit statement. Don't fall for it. Don't let it stop your heart. ER means employer. And something else that's going to help you in your retirement is to keep your contact information up to date, not just with UC Rays, but with the UC Davis Retiree Center. So I have a little informational logo here to remind you, after you retire, don't forget, if you change your email address, make sure to let the Retiree Center know and keep that contact information up to date, please. So we talked about medical, dental, legal, and vision service plan. Now let's talk about some of the other benefits that you might be wondering about as you retire. The identity theft protection that you have through Experian, that continues. There's nothing for you to do. It's automatic. You don't pay for it. It just continues. AD&D. AD&D stands for accidental death and dismemberment, the ghastly named plan that will pay in the case of accidental death, or if you need to know how many fingers and toes you need to lose before the plan pays, you can find that on UCNet. But that is something you can continue into retirement by direct payment to the Prudential. Look on UCNet for instructions how to do these things because I'm really not that familiar. AD&D you can continue, but life insurance is another story. Life insurance ends, and if you want life insurance into retirement, you are allowed by the Prudential to convert your life insurance to an individual policy. There are two ways to do this. Both are exorbitantly expensive. I don't know anybody who has converted their life insurance to an individual policy because it costs like a house payment a month. But if you're terminally ill or something like that, there is a way to do it. Disability insurance, that's something you shouldn't need after you retire because the whole idea of retirement is to have enough income to live on while you don't work. Disability insurance is intended to replace income while you can't work because you're disabled, so it should be unnecessary. So disability insurance ends the last day you're actively at work or on vacation. When it comes to the tax savings programs, the Health FSA or Flexible Spending Account, the Dependent Care FSA or DEP Care, and TIP. TIP is the Tax Savings on Insurance Premiums program. That program, TIP, if you allow it, it makes anything you pay for medical plan premiums pre-tax. You can't do that as a retiree. You can't do any of these tax avoidance measures as a retiree, so just be aware of that. The only thing I can think of that you can tax defer from your retirement income, and you can't even do it directly from your retirement income, is health savings account contributions. HSA contributions are only allowed if you're in the Health Savings Plus plan, and they can't come out of your retiree pension check, but they can be transferred to your HSA from your bank account, a checking or savings account, and then Health Equity that manages that money will issue a tax statement at the end of the year that makes whatever you put in there pre-tax. So if you're somebody who's contributing to the HSA, not FSA, HSA, there is a way to make that work even after retirement. When it comes to auto insurance, homeowners insurance, renters insurance, boat insurance, if you have any of that stuff through California Casualty or State Farm or whatever it is, Farmers, I can't remember what we use anymore, that can be continued into retirement, again, if you arrange direct payment with that vendor. Again, look for instructions on UCNet or contact information on UCNet. The AFLAC style plans, which I believe are through the Prudential now, called the Accident, Critical Illness, and Hospital Indemnity plans, those are not offered to retirees. Uh, those end. And pet insurance. Pet insurance is something that you can continue through direct payment to Nationwide if you want to continue doing that. So those are the other benefits that Nick and I don't really work with. Let's move on. Let's talk about what it takes to be eligible for any of this. Let's talk about how much service credit you need, how old you need to be when you retire in order to be eligible for coverage as a retiree. Well, in order for you to get a UC contribution toward medical and dental insurance into retirement, you have to have enough service credit and you have to elect monthly retirement income. Okay. You can't take the lump sum cash out. So there's a warning logo here. If you elect a lump sum cash out, you forfeit UC health coverage. So if your goal is to save UC money, take the lump sum cash out. Otherwise, if your goal is not to save UC money, but to have health insurance into retirement, if you have enough service credit and you elect the monthly pension, and if you retire within 120 days of terminating UC employment, then you should be able to continue coverage into retirement. Now, this 120 days business is serious business because you might think about leaving UC at age 45 to go work someplace else and then come back to UC later and say, hey, I want to claim my pension and health insurance. No, that's not going to work. I know that the highest age factor is 60. So if you're holding out for the higher age factor for the 1976 tier of 60 and you leave at 45 or 52 or something like that, and you come back, you're not going to get health insurance through UC unless you come back to work for us in a UCRP eligible position for at least 12 months. If you're not in the 1976 tier, the highest age factor is age 65. So you might be tempted, hey, I'm gonna leave now, not claim my pension, come back at age 65 and say, hey, I want my pension and health benefits. You can claim the pension that way, but you will not get health insurance. Again, unless you come back to work for UC for at least 12 months in a UCRP eligible position. These benefits are designed to attract and retain employees. These benefits are designed to get the hooks in you and then keep you here as long as possible. The benefits are not designed to reward you for leaving and coming back. No. Okay? So keep in mind, you got to have continuous insurance coverage. You got to have a retirement date that is within 120 days of your separation date. And I would warn you that if you have a break in service that's that long, I mean, you're just asking for trouble. If I was you, I would retire immediately after separating from the university. I wouldn't push it 100 days or whatever it is, because if you end up have continuous coverage for health insurance, because if you're gone that long, you're not getting a paycheck anymore, but you're also not getting a pension check. So don't do that. I think the reason there's this little cushion in here is that sometimes people aren't quite to the age factor that they want. And so that gives you a little flexibility, but I wouldn't push it too long. Usually you're going to retire the day after you separate from the university, unless you are in the 1976 tier and you're retiring on July 1st to take advantage of the inactive COLA, which I'm not going to get into. I'm not a pension expert. I'll let the pension experts in this series tell you more about the inactive COLA. But if you're taking the inactive COLA and retiring on July 1st, you do need to have that 1-day break in service so that you separate June 29th. You are inactive on June 30th, and then July 1st, you get that cost of living increase built into your pension for the rest of your life, which is pretty sweet. Now, it's very important that when you retire, you understand which insurance group you're in, which insurance eligibility group. It is determined by when you joined the retirement plan, not by, when you were hired, because you might have been hired in a temporary position like I was. And I didn't earn service credit in UCRP while I was working for the temp pool. But once I was hired into a career position, retirement plan eligible, that's when I started earning service credit as a UCRP member. Okay, so there are three eligibility groups. If you've been here for quite a while and you were somebody who joined the retirement plan before 1990, then it doesn't take much service credit to get 100% of the UC contribution toward medical and dental. And I'm going to be talking a lot about the UC contribution and 100% of the UC contribution and that kind of thing. I'm going to make it clear to you as we go through the presentation. What do I mean when I say 100% of the UC contribution? What does that mean in dollars? Well, I'll tell you how to figure that out as we go along. Don't worry. But if you're in group one and you joined the retirement plan back in the day before 1990, if you retire at ages 50 to 54, it only takes 10 years of service credit. Age 55 or greater, 5 years of service credit, and you get 100% of the UC contribution. Not much service credit. But most of us are probably in group two. You're in group two if you joined the retirement plan on or after January 1st, 1990, but before July 1st, 2013. So if, like me, you joined our retirement plan in the 90s, in the 2000s, but before July 1st, 2013, then you are subject to the dreaded graduated eligibility, which I will explain in a moment. If you have less than 20 years of service credit, you get some fraction, some percentage of the UC contribution if you are subject to graduated eligibility. Graduated eligibility means that you're getting some percentage of the UC contribution on a graduated scale that is based upon how many years of service credits you're retiring with. And I'll show you what those requirements are momentarily. But you avoid graduated eligibility by retiring with 20 years of service credit if you are in group two. So a retirement goal for you, if you're in group two, you want to have 20 years of service credit, right? You want to be at least, if you're in the 1976 tier, another goal would be you'd want to be at least age 60. Another goal, if you're in 1976 tier, you want to retire on July 1st with a break in service of 1 day to get that inactive COLA. So these are different goals that you can set for yourselves as you plan for retirement. If you're not in the 1976 tier and you're in group three because you joined our retirement plan on or after July 1st, 2013, you are subject to a more extreme graduated eligibility that says that in order for you to get 100% of the UC contribution, you not only have to have 20 years of retirement plan service credit when you retire, you also need to be at least age 65 to get 100%. If you have less than 20 years, you're not going to get 100%. If you're less than age 65, you're not going to get 100%. I'm going to make that more clear as we go along. But you just need to focus on different goals, right? The goals that you might set for retirement if you're in group three, you want to get 20 years of service credit, obviously, and you want to be at least age 65 when you retire. And that helps you because not only does it increase the percentage that you get of the UC contribution toward medical and dental, age 65 gets you Medicare. And our Medicare plan premiums for our retirees tend to be lower than our non-Medicare plans, and they also tend to include richer benefits. Our Medicare plans for people who are retired are better than any active employee plan, in my opinion. Okay? Also, if you're in group three, there is no UC contribution unless your retirement age is 56 or greater. So you need to be at least age 56. So there's another goal you might want to set. If you're in group three, you need to be at least age 56. 65 is much better. And you want to get those 20 years under your belt so that you have 100% of the UC contribution. So let's get into more detail about graduated eligibility for those in eligibility group two. If you're in group two, then the chart here shows you what percentage of the UC contribution you're going to get. And I'm going to tell you how to translate that into actual dollars as we go along. But I want to point out that as you look at this chart, keep in mind that the percentage of UC's maximum contribution is based on full years of service credit. So it doesn't round up. If you have 14.9 years of service credit, you don't have 15 years, you have 14 years, okay? It does not round up. But another thing you need to understand is that if you earn sick leave counts as service credit for pension purposes as well as health insurance eligibility purposes for retirees. So you want to hoard that pension. Yeah, you want to hoard that sick leave, I mean, because it is pension when you retire. It improves your pension to have a year of sick leave on the books, for example, by a year. If you want to hoard that sick leave so that when you retire, that sick leave is converted to UCRP service credit, and you can factor it in when you figure out what percentage of the UC contribution you're going to get and what your pension is going to be. So taking a look at the chart, if you retire with less than 5 years of service credit, you're not going to get any UC contribution. You can't even retire with less than 5 years of service credit through our retirement plans. So that's why not applicable applies there. But if you join the retirement plan between 1990 and June 30th, 2013, and you have less than 10 years of service credit, but you have at least 5, then you might qualify for 50% of the UC contribution. And the way that you might qualify is through what we call the Rule of 75. The Rule of 75 says that if your age plus your service credit is at least equal to the number 75, then you're going to get 50% of the UC contribution. So this is designed to help people out if they join us at a late age. I did not call you old. I said if you join the retirement plan at a late age, but you're in graduated eligibility group 2, if your age plus your service credit equals 75 or greater, then you can get 50% of the UC contribution. So let's say you retire at age 68 with 8 years of service credit. 68 plus 8 is 76. That's more than 75. You would get 50% of the UC contribution, even if you didn't have the full 10 years that you would normally need. And as you can see, 10 years does get you 50%. So you want to get at least 10 years of service credit if you're in this eligibility group, because that's going to get you 50% of the UC contribution. If you get less than 10 years, you're going to have an advanced age, so those numbers work out, okay? But for most of us, we're going to retire with either 10 years or more. 10 years gets you 50%, then it's 5% of the UC contribution for every year above 10. Okay, so 10 years gets you 50%, 11 years gets you 55%, 12 years gets you 60%, 15 years gets you 75%, 19 years gets you 95%. Why not hang in there another year, right? 19 years gets you 95%, but 100% is what you get when you have 20 years or more. So 20 years or more, if you're in graduated eligibility group 2, means that you don't have to worry about graduated eligibility. You get the whole shebang, you get 100%. Unless you're in group 3. Now let's talk about eligibility group 3. Again, full years of service credit, does not round up. Sick leave is included. If you earn sick leave, hoard that sick leave so that you can use it at retirement. But if you joined our retirement plan July 1st, 2013 or later, you are subject to the more extreme graduated eligibility that says not only do you need to have more years of service credit, you also have to have a higher age at retirement to qualify for a higher percentage of the UC contribution. So there is no rule of 75 here. It's solely based on age and service credit, like so. 10 years of service credit would get you 5% of the UC contribution at age 56. I'm going to tell you right now, our plans are very nice. Our medical plans are very nice here at UC. Very nice plans are not cheap. They are expensive. So if you're getting only 5% of the UC contribution towards a UC health plan that's very expensive, that means that you're paying a whole lot for that coverage. This is not affordable. I mean, if you can afford it, great, but these are not affordable numbers at age 56. 10 years of service credit at age 56 is only going to get you 5% of the UC contribution, only 25% at age 60, but at age 65, it's going to get you 50% of the UC contribution. So obviously age is significantly rewarded here. As is service credit. 15 years gets you 7.5% at age 56. Again, not affordable, but it gets you more and more the older you are as you retire. Let's say you have 20 years of service credit or more when you retire under this eligibility group 3. If you retire as young as 56, you're only going to get 10% of the UC contribution. Still not affordable. But at age 60, it's 50%. And at age 65, that's when you're no longer subject to graduated eligibility. So if you're in this eligibility group, you want 20 years and you want to be 65, you get Medicare at 65, and it's gonna help reduce your costs and improve your benefits if you can hang in there till Medicare age. Okay? Now, if you're not sure after seeing these slides about what percentage of the UC contribution you qualify for, I'm going to tell you about a tool that you can use to figure that out a little more easily later on down the presentation. I also want to point out that if you leave and come back, this is what you're looking at. If you leave the university to go take a job someplace else, and then you come back and you want to get health insurance, so you come back and work for us for at least 12 months in a UCRP eligible position, you can do that, but you're going to be in eligibility group 3, which means that if you left us in eligibility groups 1 or 2 because you joined the retirement plan earlier, but then you leave the university, you don't retire, you come back later, you want health insurance, so you come back to work for us for a year in a UCRP eligible position, even if you were in group 1 or 2 before, now you're in group 3. And you have to have the higher age and the 20 years of service credit to get 100% of the UC contribution. So again, this benefit does not reward people who leave and come back. Having said that, if you do retire from the university, but then the chancellor pulls you back to work on a special project or something like that, and you come back, you stop your UC pension, and you come back to a UCRP eligible position as an active employee, then when you re-retire, you would retain your original eligibility group 1 or 2, if you were in that kind of situation. So just understand that if you're a rehired retiree who stops your pension and you come back to employment where you're an active UCRP member again, that's different, that's special, and you have some protections there. Now on to our bar charts. You are going to see this bar chart several times throughout this presentation as I use it to make some different points about UC's contribution toward retiree health benefits. And as we go through this presentation and you see this bar chart, you always want to focus on that gold bar. The gold bar, the yellow bar, that's what we're all working towards. That gold bar is a visual that represents the UC contribution toward medical and dental coverage. And in this example, it's set to 100. This shows somebody who is not subject to graduated eligibility. They get 100% of the UC contribution. Next to the gold bar, we have the blue bar. The blue bar is a sample medical plan premium for a retiree that does not have Medicare. So you'll notice that there's this net cost that I highlight here. The net cost to you out of your UC pension check is the difference between what the plan charges and what UC will pay. That's the balance that you have to pay so that the full premium goes to the health plan and you can be covered. Okay? So that net cost is going to be minimized if you have more service credit when you retire, because if you get a higher percentage of the UC contribution, you're going to pay less for health insurance, which should be obvious to you. But here's a visual that really displays it. The red bar is a medical plan premium for someone who is coordinated with Medicare. So notice that the red bar is lower than the blue bar. It isn't necessarily as low as the gold bar. You're still most likely going to be paying something for health insurance even when you have Medicare, but it's usually not as much as it would be if you didn't have Medicare. So the red bar is lower than the blue bar, but I want to focus on this blue bar compared to the gold bar. This is the net cost that I'm going to display in actual numbers on the next slide. Here is what we were visualizing. Here we have example A. We have somebody who retires who gets 100% of the UC contribution because they were in group 2 and they retired with 20 years of service credit. They're not subject to graduated eligibility. They get the whole shebang. This employee is retiring with HealthNet, the UC Blue and Gold HMO, and this retiree is covering a spouse. Nobody has Medicare in this example. Okay, so we have two people covered by Health Net. The total medical plan premium for two people to have Health Net, if you can believe it, is $2,449.31 a month in 2026. It's almost $2,500 for two people to have an HMO in 2026. That's how crazy healthcare inflation has been. The maximum UC contribution that the university can make towards two people's coverage is $1,621.82. That's somebody who's getting 100%. The maximum that UC will pay, 1621.82. That leaves a balance to this retired couple of $827.49 per month. That's how much is going to come out of this retiree's pension check. Okay, so it's not cheap to have Health Net, and you'll notice that you wouldn't be paying that much if you were working. So you might be thinking to yourself, "Oh, 100% doesn't mean that I'm getting the same deal I got as an employee," and you're not, because 100% of what UC will pay is lower for retirees than it is for employees. And I'll talk more about that at the end of the presentation. But if you have Medicare, it balances out better. But if you don't have Medicare, you're really going to notice it when you pay your medical plan premiums, because these are nice plans, as I explained before. They have high premiums, and if you don't have as much of a UC contribution towards those premiums, you pay more. So the benefit design here is, again, trying to encourage you to stay longer so that we have more experienced people working for us as long as possible. But now let's go back to that bar chart and let's talk a little bit about graduated eligibility. In the same bar chart we had before, except for one major difference, the UC contribution has been cut in half in this example. If you take a look at the gold bar, it is set to 50% of the UC contribution, okay? Notice that the blue bar and the red bar, the medical plan premiums, they don't go down just because you didn't work here very long, okay? Health Net has to charge what Health Net has to charge. Blue Shield has to charge what Blue Shield has to charge, regardless. The amount that UC contributes is definitely dependent on how long you've worked here. So notice this net cost. The difference between the sample medical plan premium and the gold bar is huge, even if you have Medicare. So it's big for the red bar as well. But again, we're going to do a non-Medicare example here, and we're going to focus on this net cost between the blue bar and the gold bar. That's the visual. Here are the actual numbers. Here we have example B, that is an example for somebody who is subject to 50% graduated eligibility. They only get 50% of what UC will pay toward medical and dental insurance, which does not mean that they pay half and UC pays half. No, because what the plans charge is above 100% of what UC would pay. So if you retire with 50% graduated eligibility, then you are paying 50% of what UC will pay plus the difference between what UC will pay and what the plan charges. So take a look at these numbers. Again, we have an example of a retired couple who is in group 2, but the employee is retiring with 10 years of service credit, so they get 50% of the UC contribution. Again, it's a Health Net example, the UC Blue and Gold HMO with a spouse. So it's almost the same example as before, except this time a 50% UC contribution. Again, the total premium for two people to have Health Net is just under $2,500 a month. The UC contribution is cut in half in this example. Remember that the maximum contribution in the previous example was $1,621.82. Well, this couple only gets 50%. They get $810.91 off the $2,449 premium, leaving a net cost to this retiree of $1,638.40 per month. This couple is going to pay $1,600. This retiree is going to have $1,600 knocked out of his or her pension check to pay for Health Net, just to have Health Net every month. Okay, if this does not convince you to, number one, come to work for the university earlier, right? What's the best time to plant a tree? This is something that I learned from my father-in-law, who owns a nursery. What's the best time to plant a tree? It's 30 years ago, okay? 30 years ago. You should go to work for UC earlier in your career so that you can accrue more service credit, so that you can take full advantage of our amazing benefits here. But let's say you didn't. Let's say you worked here for only 10 years. At least you have a UC contribution towards plans that are better than you could get out in the real world anyway. But you can see this is expensive. If this doesn't convince you to stay here longer or start here earlier, I don't know what will. Now, we're going to get into how you calculate the rates I just showed you. But before we do that, there are things that I want you to understand about the UC retiree health plans. For example, don't expect some completely different menu of medical plans when you're retired. No, it's pretty much the same plans you saw as an active employee. There are exceptions due to Medicare, we're going to have a whole section on Medicare in this presentation, so you'll know what I mean in a little bit. But it's the same menu of medical and dental plans as before. It's also the same eligibility rules for family members. Yes, we cover spouses. Yes, we cover grandchildren who are your tax dependents and live with you. Yes, we cover your children and overage disabled children. If you meet all the eligibility requirements, they're all the same eligibility requirements. And all those eligibility requirements are on UCNet if you're wondering. But something that's also the same is occasional verification and re-verification through Unify HR. If you get mail or email from a company called Unify HR, you need to, jump on that. Okay, you need to pay serious attention to anything you see from Unify HR because that's the company that UC uses to figure out whether you're still married to your spouse or whether that grandchild is still your tax dependent, that kind of thing. Or if you are newly married, they'll want a copy of your marriage certificate, that kind of thing. UC has had way too many employees fail to disenroll an ex-spouse and fail to disenroll a grandchild that no longer lives with them and that kind of thing. That UC ultimately should be saving money by paying Unify HR to occasionally check with you to see, hey, are you still married? Does that grandchild still live with you? Are they still your tax dependent? So you need to provide that information to Unify HR when you see it. And when you get it in the mail, it should be co-branded with University of California logos as well, so that you'll know it's not a scam. It's not a scam. It's quite legitimate, and you must pay attention if you're covering any dependents. You may be asked to re-verify that you're still married to your spouse every 3 years or so. They kind of suspended it during COVID, but they're back on schedule now. Something else you might want to know. Working here involves extremely valuable benefits that are very protective of you and your families. Okay? Your survivors may continue health coverage even if you pass away before them, if they're eligible for a survivor's pension. Okay? So if you're married to somebody for at least a year prior to your retirement, or you've established a domestic partner for at least a year prior to retirement, they are well protected. As long as you take the monthly pension, they're going to get at least some percentage of your pension. Decease them if you pass away before they do. So this is a very, very valuable benefit. I'm getting a message that my internet connection is unstable. So Nick, wave at me or bang on the wall or something if you can't hear me, okay? Okay. Nick and I are on the same internet connection, so I don't know if that'll work, but that's all I can do. Or maybe Marianne can, or Julianne can warn me.
I'm here, so I'm listening. I'll let you know.
Okay, hopefully it's not too choppy.
Sounds fine right now.
Okay, so I have an informational logo down here. I want to give you a heads up about something. Retiree health coverage. Then you are safe to ignore the following letters. Don't let them stop your heart or confuse you, okay? When you separate from the university and retire, UC Davis stops paying for your health coverage through UC Path. And when your medical plan finds out that you're no longer covered through UC Davis, they have to send you a letter saying, hey, your coverage is terminated. They have to send you that letter, even if you're going to be eligible for coverage as a retiree. You're going to get this letter and it's going to mean nothing to you if you have retiree health coverage. Don't worry about it. It only matters to you if you don't qualify for UC retiree coverage and you need that letter in order to get coverage through your spouse's job or whatever. So just don't let it stop your heart. Similarly, it would be very difficult for the university to suppress the automatic offer of COBRA continuation. COBRA continuation. COBRA stands for the Consolidated Omnibus Budget Reconciliation Act of 1985. It's not a snake, but the acronym sounds like a snake, but it's not a snake. It's a federal law that says you can continue your employer-sponsored health coverage by paying for it yourself. If you lose it for certain reasons, you can continue it. Well, if you're eligible for retiree coverage, you don't need COBRA continuation to continue it. You're going to be getting coverage through the UC retirement system, through the RASC, right? So the COBRA offer will come from a company called WEX, W-E-X. If you get this COBRA continuation offer as you retire, just tune it out. Just ignore it. Recycle, recycle, recycle. Something else I want you to know. UC doesn't know which retirees are rich and which ones are poor. We don't salary band retiree health insurance premiums the way we do when you're an active employee. When you're an employee, we know how much you make. We're paying you. So we pay based on income to subsidize the low income who work for UC, but we don't do that when you're retired. You retire. But this may actually mean that if you retire and right now you're in a high salary band and you go to retire, you may actually pay less for health insurance retired than you did working, only because of the salary band difference. But it can also mean that if you're in a lower salary band and you retire, you're going to pay even more than you might have expected because you're no longer getting preferential treatment because you were low income. So just be aware of that. It's a little simpler in the sense that there's no salary banding for retiree coverage. Something else to know. You can change medical plans after retirement itself is not considered a life event by the university that allows you to just change medical plans. I know the state lets you do that. UC does not let you do that. I'm sorry. But you can change medical plans during open enrollment. And yes, it's the same exact open enrollment that you have as an employee. It's the the last few days of October, ending the Friday before Thanksgiving, just like it was when you were an employee. Okay. So yes, you'll have open enrollment, and open enrollment changes are always effective the first of the following year, same as when you were an employee. You can also suspend your medical and or dental coverage when you retire, or actually anytime after you retire if you want to. Let's say you retire and you have coverage that you can get. You don't have to have our coverage. You can suspend it.
Hey,
And
Garrett, it's
yes,
Julianne. So you are, I don't know if everybody else, maybe people could do a send a reaction or something. You are like some of your words are completely gone, parts of it, and I'm wondering if maybe you could turn your video off while you're
yeah.
having some instability of the internet. Looks like everybody else is hearing it the way I am too. Okay, sorry to interrupt.
Oh no, thank you for the warning because I don't want to talk and have nobody hear me. But anyway, just to recap, you will have open enrollment when you retire, and you can suspend medical and dental coverage and then get back into it during open enrollment. Or if you can prove the involuntary loss of other coverage, like let's say you suspend your medical and or dental coverage through UC because you're covered by a spouse and your spouse retires. Well, even if your spouse voluntarily retires, we would consider the loss of their coverage to be involuntary, and you could pick up coverage through UC. Whenever you have these kinds of life events, when you're an employee, you're going to deal with the benefits office and UC Path to make changes to your health coverage. But when you're retired, you don't go to the benefits office. You go to Nick and I. We, the healthcare facilitators, your local healthcare people, we help people with these life events all the time. So call us, try to call us in advance. But technically, you have 31 days as of the date that a life event occurs to make changes to your health benefits. We call it a PIE, or period of initial eligibility. Your PIE period is your window of opportunity to enroll that new spouse or enroll that new grandchild who has become your tax dependent and lives with you, or that child that you've adopted, or whatever it might be. Uh, you have 31 days to take action. Now, I would argue that you should get paperwork done in advance, but technically you have 31 days as of the date of those life events to take action. So that means adding new family members or uh, acting because you've lost coverage through another source, the involuntary loss of coverage. I also want to point out something. We have a medical plan called the Health Savings Plus PPO through Blue Shield. Health Savings Plus is a special medical plan that is designed to be compatible with health savings accounts. Medicare and health savings accounts do not go together under IRS rules. You cannot contribute to an HSA, a health savings account, if you have any part of Medicare. So if you're retired or you retire past 65 and you get Medicare, you're going to have to choose a different medical plan. We essentially have to give you what's like your own personal open enrollment to choose any Medicare coordinated plan you want if you have the Health Savings Plus plan and you and any covered family member become eligible for Medicare. So heads up there. If you strategically want to have any choice that you want, you might put yourself in the Health Savings Plus plan before you get Medicare, uh, because it's almost like we have to give you your own open enrollment and you'll have full flexibility. Otherwise, as you'll see in our Medicare section, you really won't have choices when you get Medicare. You will simply transition from the non-Medicare plan that you have to a Medicare version of that plan that is not your choice per se. But more on that as we get into the Medicare section. Something else to know. In my experience, retirees do not sit still. They flitter here and about all over the globe. And you need to understand that if you're in an HMO plans are really prepaid medical plans. They are not health insurance. It is an arrangement where an insurance company prepays a local medical group to take care of you. So geography becomes destiny if you're in an HMO. But it also means that if you're not where the prepaid medical group is, that you're not covered except for emergencies. You need to understand that if you're going to move or travel temporarily outside the service area of an HMO for 2 months or more, you're not only allowed to change medical plans to health insurance, which would be a PPO, you're supposed to change to a PPO if you're going to do that. If it's temporary and then you come back, then we'll let you switch back to your original HMO if you want. But again, you'll have 31-day windows to take action if you're going to move or travel. Try to do things in advance, but technically you can do things 31 days after the life event. And again, call me, call Nick. We help people with this stuff all the time. Okay, my slide is not advancing. There we go. Okay, at long last, this is the part of the presentation where I'm going to tell you how you can calculate your retiree health insurance premiums. And you're going to do that by going to our website, the Healthcare Facilitator Program website, which is displayed here on the slide. And it's also next to my name on the Zoom window that shows my little black and white photo. If you go to our Healthcare Facilitator Program website, you're going to find a couple of Excel spreadsheets that are going to be useful to you. First, we have the UC Retiree Premium Estimator. This Excel spreadsheet will not only tell you what medical plans will cost you if you were to retire in 2026, they will also help you understand what percentage of the UC contribution you'll be eligible for. So you'll answer some questions on this spreadsheet and it will tell you, do you get 100%? Do you get 50%? Do you get 65%? Do you get 22%? It's going to help you calculate what percentage you qualify for and your medical plan premium, no matter how many family members you're covering, and even if you or any covered family members have Medicare. It takes into account Medicare as well and shows you what all the premiums look like. And there's also a tab that you can click on where all the medical plan premiums for your scenario will be compared side by side so that you can see the side by side comparison of their premiums. There's also a link from the spreadsheet to the Medicare website. Really, it's to my favorite Medicare premium chart. It's my favorite because I think it's the easiest to read. Because if you're a retiree with Medicare, you gotta figure you're gonna pay your premium from your UC pension check, but separately you also have to pay for Medicare, so you need to consider that cost as well. So I try to make it easy by putting a link on the spreadsheet. So you got the UC Retiree Premium Estimator that is a potent tool for helping you understand your costs so that you can plan for retirement. You could also use it after you retire to understand your options. And of course, I update it every open enrollment. But there's another spreadsheet on our website that you could use. It's the UC Medical Plan Availability Tool. Remember I said that with HMOs, geography is destiny? Well, HMOs are only available in half the counties in California, the urban parts of California. So you can't even move to Chico to be near the Sierra Nevada Brewery in retirement and keep an HMO. You're going to have to switch to health insurance. You're going to have to switch to a PPO if you go any place rural or if you go out of state. And this spreadsheet will let you enter a zip code and overlapping county, and it will tell you whether there's an HMO available there. It'll also tell you where the PPOs are available and where the Medicare PPOs are available. And it'll even tell you a little bit about VIA benefits coverage, which we'll talk about in our Medicare section. If you end up moving out of state, once you and all covered family members have Medicare, you're not covered directly for medical through UC's retirement system. Instead, you'll get coverage through this giant insurance broker called VIA Benefits, which we'll talk about later. All of these things are addressed in the UC Medical Plan Availability tool, which you may find useful. Now, I want to give you a heads up about something, and here's the warning logo here, the danger red triangle. Those of you who are retiring but thinking about coming back to work for UC part-time, be warned. Be warned. If you are rehired within 6 months of retirement, you may not get to keep your retiree coverage, and you may want it, okay? If you are rehired within 6 months of separating from the university, you will still be technically eligible for health insurance. Why that have to do with Medicare, but under federal law, Medicare is secondary to health insurance through active employment. Regardless whether you have Medicare or not, if you are going to be a rehired retiree and you are rehired within 6 months of retirement, your retiree medical coverage is going to stop. Warning, it will stop. And you'll have to get coverage through UC Path, through UC Davis as an active employee. So this requires that you take some care and you coordinate with us and UC Path, etc. Now, if you're somebody who doesn't have Medicare, you may be advantaged by this arrangement where you get employee rates. But if you are a retiree who has Medicare or who has a family member who has Medicare, your superior retiree Medicare plan is going to stop if you come back to work within 6 months. So be very careful about this. It's not simple if you come back within 6 months. Now, if you do come back within 6 months and you are appointed at 43% time or less, and it's been more than 6 months before you're rehired, you don't have to worry about this. Your retiree coverage will continue, and the sun will shine and the birds will sing and everything will be fine. As long as you come back within 6 months or after 6 months, as long as you come back after 6 months and you come back at 43% time or less, okay? Now, if for some reason you can't do that because you must come back because of grants or something like that, or you just really, really want some vacation money and you do come back within 6 months, coordinate with us. Call me, call Nick. We'll help you deal with the consequences of your recall. Trying to get the slide to advance here. Okay, next up, we're going to talk about Medicare. Now, I like to joke that even though a Medicare card is red, white, and blue, it should be green because Medicare is worth a lot of money and you've paid a lot of taxes to get it. But before we get into information about Medicare, I think we should take a break. Let's take a break and resume at 10:15 a.m. So come back here at 10:15 a.m. and we will get started on the Medicare section of health insurance after you retire. And who knows, maybe my internet will be more stable at that time. We'll see you back at 10:15.
Thanks, Karen. Thanks, Nick. 10:15. See you then.
I don't know if it'll help, but I just turned off Wi-Fi. Maybe it'll somehow help my internet connection, but I think I should go back on camera until you tell me not to again.
Okay,
I
sounds like
just
a good plan.
I just know that if I was listening to some blowhard go on and on about health insurance, I would want to at least see the speaker.
It's always better, but it's also so important that they get the information. So, whatever works, and I will interrupt if you start cutting out again.
Thank you.
Yep. I keep my video or my audio off for lots of reasons, but the one is I've told the panelists this before. We have a 90-pound dog and he loves to howl if he hears a siren or something. And he's got an incredible voice, but he's so loud. Even if he's on the other side of my double doors, it sounds like he's sitting right next to me. Um, and then I start laughing. So
He's a
anyway.
wonderful opera singer.
Oh, wow.
He is, yeah. He's got an incredible voice. He puts his whole heart into it. Anyway. Okay, whenever
All
you're ready
right.
to start.
It is 10:15, so let's get back to it. So let's talk about Medicare, which, for the unfamiliar, is the federal health insurance program for most people in the United States who are age 65 or older, or you can become eligible for Medicare before age 65 if you're disabled for 24 months and getting Social Security disability income for 24 months, or if you have permanent kidney failure, or if you have ALS or black lung disease, if you were a coal miner. There are some ghastly ways to become eligible for Medicare before age 65. But for most people in the US, if you're retired and you're 65 or older, you're going to have Medicare. Now, there are multiple parts of Medicare. Medicare Part A is the hospital part of Medicare. It pays for facility fees if you're in a hospital or skilled nursing facility temporarily. So Medicare Part A is the part of Medicare that is paid for by taxes, and it is premium free for most people. So if you paid into Social Security for at least 10 years, or if you married the right person, you won't pay anything for Medicare Part A. You can qualify for Part A through a spouse, through their taxes. So Part A, hospital insurance, free. But Part B is not. Medicare Part B, as in boy, is the medical part of Medicare. Medicare Part B pays for things like physician fees in and out of the hospital. It pays for durable medical equipment, lab work, imaging, emergency rooms, that kind of thing. That's Medicare Part B. If it's something that's outpatient that isn't drugs, it's probably covered by Medicare Part B, as in boy. And we'll talk about Medicare Part D, as in drugs, later. But for now, I want to focus on parts A and B. Medicare Part B costs $202.90 per month, so about $203 a month in 2026, unless you're super high income. Super high income means if you are in the top 7% of earners in the United States, Social Security is going to charge you more to offset costs for the 50% of Americans on Medicare who make less than $38,000 a year or whatever it is. If you're paying high income premiums, you are subsidizing the rest of America. You are a patriot, subsidizing the low income. But understand that Social Security is always using 2-year-old tax information to figure out who is in the top 7%. So in 2026, they're looking at your 2024 adjusted gross. They call it the MAGI, which is the modified adjusted gross income. The modification is that it's your AGI plus tax exempt interest income if you have any. Maybe you have tax-free municipal bonds or something. I don't know how you get tax-free interest income, but if you think about it this way, if your AGI 2 years ago was above 109,000 for those filing singly, 218,000 for couples filing jointly, then you're in the top 7% and they're going to charge you more unless you appeal successfully. And the way you appeal is there's a form, and we'll tell you about it if this comes up, we will, call me, call Nick. We will help you understand what form you need to appeal. But what you're doing with the appeal is that because Social Security is using 2-year-old tax information, they're using your income from when you were working. And that you're not necessarily going to make that kind of money when you're retired. And Social Security knows that they need to have an appeal process here because they have to set premiums each January. But nobody's done their taxes in January. People have until April 15th. So they're always using outdated tax information, and that's why they have an appeal form. And with that appeal form, you would need to communicate to Social Security that your expected adjusted gross in 2026 will be lower than it was in 2024. If it was lower, you might be able to reduce your Medicare premium. Um, if it won't be lower, that's awesome. I hope all of you pay high income Medicare premiums for the rest of your life. You might be paying more for Medicare, but it means that you're doing better than 93% of the rest of the country, which, is great. And it's not like they're going to charge you so much that you'll be at a net loss. So just be aware that Medicare costs more if you're high income. And if you're somebody who's doing a Roth conversion, watch out because you have a lot of taxable income that might affect your Medicare premiums. Watch out if you're somebody who takes a big distribution from your 403B plan to replace your leaking roof. 2 years later, it may affect your Medicare premium. So tax advisors and financial planners don't always think about this stuff, but now you know. Medicare, you're charged on a sliding scale if you're high income, but most of us will pay 202.90 in 2026 for Medicare Part B. Now, something informational, I put the little informational eye logo here. I want to give you a heads up about something. When you're retired, it's UC's open enrollment that matters to you if you're covered by UC retiree insurance. Okay? If you are retired from UC and you're getting our coverage, you don't live in the real world. You live in the UC world where things are better. And you don't need to worry about Medicare's open enrollment. Medicare has there's a fall enrollment period, there's a general enrollment period. You don't care about that stuff if you're covered by UC retiree health coverage, unless you have moved out of state and you are not covered by us directly. You are covered by VIA benefits, which we'll talk about later. If you're covered by VIA benefits, then yes, Medicare's enrollment periods do matter. But for most of us, if you're in California and you're retired, if you are anywhere near age 65, you know you're going to get all kinds of marketing. Every insurance company out there wants your Medicare. You're going to want to ignore all the marketing, the flyers, the billboards, the TV ads, trying to sell you Medicare Advantage plans and Medigap plans. You don't care about those plans. You care about UC plans, which are better and are partially funded by UC. Okay, so focus on UC's open enrollment. You should know that UC relies on Medicare to offer health insurance for retirees, and it literally offsets the cost of insurance for employees and retirees. Obviously, if you're retired and Medicare is coordinated with your medical plan, it's either paying claims that offset your plan's costs or it's paying your plan directly. Either way, it's directly subsidizing retiree health coverage, so it's very valuable. But it also indirectly offsets costs for active employees because if you look at the pool of active employees who are covered by health insurance, those who retire and get Medicare are pulled out and they have a different risk pool. So the people who are older, the people who are disabled, the people who have kidney failure, the expensive people are pulled out of the employee risk pool, which makes it a less expensive risk pool for our active employees and our non-Medicare retirees. So what I'm trying to say here is that either directly or indirectly, Medicare is bringing your costs down, and it's very, very valuable. And for that reason, UC has lots of fussy rules around Medicare, which we'll talk about. But it also means that Medicare plans generally cost less. And even if they don't cost less for you because you're high income and you're paying high income premiums, you're still going to enjoy better coverage than you did before in most cases. So before we get into much more about that, I want to point out this chart. You may be sitting there thinking, well, what if I have Medicare but my spouse doesn't? Or I wonder what plan I might be in if I have Medicare. Well, this chart is going to answer a lot of those questions. Uh, when you have a non-Medicare plan, there is a partner plan, a plan that matches it, that is coordinated with Medicare, the Medicare version of your plan, if you will. On your left, we have the non-Medicare plans. On your right, we have the Medicare plans in red. On the non-Medicare side, we have UC Care, which is a Blue Shield of California PPO this year. We have Health Net, the UC Blue and Gold HMO, and we have Kaiser HMO. Okay. On our right, we have the Medicare versions of those plans, the Medicare partner plans. The Medicare version of UC Care is the vastly superior UC Medicare PPO, which isn't which isn't Blue Shield, it's Blue Cross. It's an Anthem Blue Cross Medicare supplement plan. Okay. If you have Health Net and you age into Medicare as a retiree, or you retire past 65, you're going to go to the UC Medicare Choice Plan, which is a United Healthcare plan, not a Health Net plan, and it's not an HMO, it's actual health insurance. It's a Medicare Advantage PPO. And I'm going to talk a little bit more about what supplements are and what Medicare Advantage plans are as we go along. But if you have Kaiser, then when you get Medicare and you're retired, you get Kaiser Senior Advantage. It's a Medicare Advantage HMO. It's the Medicare version of Kaiser. This also means that if you're in a mixed Medicare family, as I like to call it, if you're in a family configuration where some people have Medicare and some people don't, then the people who have Medicare have the red plans and the people who don't have Medicare have the black plans that match. So for example, let's say you have Health Net now and you're 65 when you retire, but your spouse is younger. And well, you would have the UC Medicare Choice Plan in retirement. You'd have United Healthcare, and you could go to 90% of the doctors in the United States who take Medicare, but your spouse would still be limited to one prepaid medical group through the Health Net UC Blue and Gold HMO. Or let's say you have UC Care, and you have UC Care through Blue Shield of California, but your spouse turns 65 before you do and gets Medicare. We would put them in the UC Medicare PPO plan, which isn't Blue Shield, and gives you access to 99% of doctors in the United States. It's an Anthem Blue Cross Medicare supplement. Medicare pays first, Blue Cross pays second. So people in that plan could go to 99% of doctors because most doctors in the United States are part of Medicare. But more on that later. Well, we're back to the bar chart. I gave you examples of the UC contribution before. Those were non-Medicare examples. Now let's get into the slightly more complicated, but also more attractive Medicare examples. We're back to the original gold bar chart where the gold bar is set to 100% of the UC contribution. This represents a retiree who is not subject to the dreaded graduated eligibility. This person gets the whole shebang. I want to focus on that red bar now, the sample medical plan premium for someone who has Medicare. Notice that there's a smaller net cost for somebody who has Medicare because the red bar is lower than the blue bar. Okay? The plan premiums, when coordinated with Medicare, are almost always lower. So there's a lower net cost to you. Again, having Medicare would be a good goal for your retirement planning. If you could be 65, if you can hang in there that long, Medicare is very valuable. But now let's look at that net cost in real world numbers. Here we have example C, the Medicare partner plan example for somebody who gets 100% of the UC contribution. Okay, so this is an employee who retires with 20 years of service credit. They're in eligibility group 2, and that means they're going to get 100% of the UC contribution because all they need is 20 years of service credit. When they were working, they had UC Care through Blue Shield of California, and they're covering a spouse. So this is two people who have UC Care, but they have Medicare. So as they retire, we're going to switch them to the Medicare version, the Medicare partner plan of UC Care, which is not Blue Shield, it's Anthem Blue Cross, It is the spectacular UC Medicare PPO plan. This plan is so nice that I'm not exaggerating when I say it. If you have UC Medicare PPO, you could literally get a $9,000 pair of hearing aids and fall down the stairs in Paris and get weeks of physical therapy on your torn rotator cuff before coming back to the United States for your kidney transplant, and you still wouldn't spend more than $1,500 all year, plus copays for drugs, which are low. And that's not even the best part. The best part is that when you're in the United States with this plan, you have access to more doctors than any private insurance could offer you because you have Medicare paying first, and Medicare rarely requires prior authorization. So the doctors who are treating you, they control your health care, not some panel of doctors at your private insurance company who might require prior authorization for all kinds of things. Okay? So this plan's very nice, but it only costs $1,145.20 a month, $1,145.20 per month for two people. Now, the maximum UC contribution for two people to have a medical plan as a UC retiree is $1,024.32 per month. So that leaves this retiree to pay a premium out of their UC pension check of $120.88, because that's the difference between what Anthem Blue Cross charges for the UC Medicare PPO for two people and how much UC will pay. So $120.88, that's what's going to come out of their paycheck, their pension check, I should say. But that's not the whole picture, because this couple also has to pay for Medicare. The Medicare Part B premium, remember, is $202.90 per month per person times two. So for a retired couple, they're spending $405.80, about $406 a month on Medicare. So if you're looking at their total outlay for health insurance premiums, you're looking at $120.88 plus $405.80. You're looking at about $526 a month for spectacular UC coverage. Now, you might be thinking, well, I can see that the $120.88 comes out of the UC pension check. That's the premium paid by the retiree. But how do people pay for their Medicare premiums? Well, I will tell you. Your Medicare Part B premium is going to come out of your Social Security check if you get one. If you don't get a Social Security check, then Social Security is going to triple up the bill and send it to you every 3 months. Okay? So you'll get a bill, which I encourage you to pay electronically. Don't put paper checks in the mail where they could be lost or stolen. If your Medicare gets canceled, it's a nightmare. So pay your Medicare premiums using mymedicare.gov. And then, at least at first, and then eventually you can set up what's called Medicare Easy Pay. That's easy like Sunday morning, not easy like the tax form. If you do a Google search for Medicare Easy Pay, you'll find instructions on medicare.gov about how to set up automated electronic payments for Medicare. You can't set those up with your bank because the premiums change every year and your bank won't know that. So you got to set it up through Medicare, and then eventually you'll get Social Security income and your Medicare premiums will come out of your Social Security check. So when I show you this number of 526.68, that really means that 120.88 is coming out of this person's pension check. 202.90 is coming out of one of their Social Security checks, or they're paying otherwise. And then 202.90 for the other Medicare premium for the other person is coming out of that person's Social Security check, or they're paying otherwise through Easy Pay or whatever. That's how it works. I know this is complicated, but there's going to be a lengthy Q&A section at the end of this presentation. Now we're back to the bar chart. This time, the red bar is lower than it was in the previous example. Again, we have somebody who gets 100% of the UC contribution. This is not somebody who's subject to graduated eligibility, but that red bar is lower. That can happen if you choose a cheap medical plan that is coordinated with Medicare. Well, then the premium is lower, and the red bar is lower in this example. So the gold bar is still 100%, but the red bar is lower. The red bar is lower than the gold bar in this example. That means that there's money left over after UC pays the premium, because the premium is a smaller number than the UC contribution is. When that happens, Because UC requires retirees to pay for Medicare when they're retired, if there's any money left over because you've chosen an inexpensive medical plan, we're going to add some money to your UC pension check. We call it Medicare Part B reimbursement. We add it to your pension check rather than charging you for a premium because we paid the whole premium already with the gold bar and there's money left over. That Medicare Part B reimbursement, if you get it, is not taxable. It's just added to your UC pension check because your plan is inexpensive and it offsets your Medicare premiums. But you have to have a really inexpensive medical plan to get any Medicare Part B reimbursement. Here are the real world numbers for one of the plans that you might be in. Here's example D, the Part B reimbursement example. Again, we have somebody who gets 100% of the UC contribution, just like the bar chart you just saw. It's an employee who retires with 20 years of service credit. They're in group 2, so they're getting 100%. But this time they have Kaiser. They have Kaiser and they're covering a spouse. And in this example, both the retiree and the spouse have Medicare. So remember, we're going to coordinate Medicare with Kaiser. We're going to put them in Kaiser Senior Advantage. Kaiser Senior Advantage is a Medicare Advantage HMO. Medicare Advantage means that these people are required to sign over their Medicare benefits to Kaiser. Medicare then pays Kaiser something like $1,000-ish per month each. So Kaiser can charge less for their medical plan premium because Medicare's throwing so much money at them. Now, notice this low premium here. The total premium for Kaiser Senior Advantage through UC, a custom, very nice plan, only $483.74 per month. Well, the maximum that UC is willing to pay is the same as it was for the other examples for people who have Medicare. It's $1,024.32. Well, $1,024.32 is a larger number than $483.74. That means that there's money left over after UC pays the premium. Therefore, there's going to be some Medicare Part B reimbursement. Now, this couple isn't paying anything for Kaiser, but they are paying for Medicare at $202.90 per person per month. That's $405.80 for two people. So they're paying about $406 for Medicare. But UC is going to add $370 to their pension check to partially reimburse the two of them for what they pay for Medicare. Okay? And that's because $1,032 is more than Kaiser charges at $483. Well, $1,024 minus $483 is $540. But the maximum reimbursement in 2026 that UC will make, which I won't get into why there's a maximum, but there is a maximum, it's $370. So this couple pays $406 per month for Medicare between the two of them, but the retiree is getting a credit on their pension check, a Medicare Part B reimbursement of $370, which leaves them a net cost of only $36 a month. $35.80 a month is their net outlay because they're paying $405.80 for Medicare, but being reimbursed $370 of that. Is that amazing? It's amazing. It blows my mind. But if you choose a cheap medical plan, you might get Medicare Part B reimbursement when you are retired. All right, so I mentioned this before. Medicare is extremely valuable, so UC has rules around Medicare for retirees, not employees, retirees, okay? The rules are as such. Retirees and their covered family members must enroll in Medicare Part B if they're enrolled in medical insurance and live in the United States, and if they can get Medicare Part A for free. If you can get premium-free Medicare because you paid into Social Security for at least 10 years, or you married somebody who did, if you can get Part A for free, you must also have B if you're a retiree. Okay, so you might chant this to yourself as a way to remember it. If A is free, I must have B if I'm a retiree. Okay, if A is free, I must have B if I'm a retiree. Now, there are some exceptions to that. If you retired past age 65 before July 1st, 1991, we won't require you to enroll in Medicare. But otherwise, if A is free and you must have B if you are covered by us and live in the United States. All right. Now, a couple of major warnings for you here. We've got the scary red triangle. For those who retire past 65 and fail to enroll in Medicare, you may be subject to lifetime late enrollment penalties if you do not enroll in Medicare immediately upon retirement. Now, there's an exception to that. If you are covered, Social Security will not charge you late enrollment penalties for Medicare if you are continuously covered by health insurance through somebody's active employment, like your spouse's active employment, then you won't have to worry about late enrollment penalties. But if you want us to cover you, even if your spouse is working, you got to get Medicare. And for us to cover them, they have to get Medicare if they're eligible for Part A for free. Retiree coverage through UC means having Medicare. So you got to enroll in it. And even if you didn't enroll in it, you might have to worry about these late enrollment penalties if you're not covered by health insurance through an active employer, through your own employment, or through a spouse. Now, UC does not require active employees or their covered dependents to enroll in Medicare. We have no rules around Medicare for active employees. Why? Because under federal law, Medicare is second and UC is first. UC is primary, Medicare is secondary under federal law until you retire, and then Medicare becomes primary. So we can't use Medicare when you're working. You have to be retired for us to put you in a Medicare coordinated plan. So that's why we don't have any rules. But here's a heads up for those who are covering domestic partners. I'm not talking about spouses. If you're a domestic partner of an active employee who is covering you with health insurance, Social Security may not let you get away with delaying Medicare enrollment past 65. Okay? Domestic partners of active employees should check with Social Security regarding their ability to defer Medicare enrollment without a late enrollment penalty, a lifetime late enrollment penalty. This is kind of a serious deal here. Spouses don't have to worry about it, but domestic partners definitely do. Okay, so there's your heads up. Now keep in mind, you can be eligible for Medicare Part A for free through a current or former spouse. You can get it through an ex that you hate, theoretically. So when you go to apply for Medicare, even if you didn't pay into Social Security much yourself, you need to make sure to mention that you were married and provide that person's Social Security number, because you could be eligible for Medicare Part A for free through a current or former spouse. Now, let's say you have Medicare, but what do you do with it now? Well, again, you're going to go with your partner plan, right? You don't have a choice here usually, but there in general are two ways to get coverage that goes with Medicare. You can't just have Medicare because Medicare was designed by Congress to be a foundation. It's not comprehensive medical coverage. If you just had Medicare, you could easily go broke paying for medical care if you didn't have something to go along with it. Well, there are two ways to get coverage that goes along with Medicare. You can either keep your Medicare or you can give it away. Okay, you can either keep it or give it away. If you keep it, if you keep the Medicare you paid so many taxes for, then you have Medicare paying first, you have a Medicare supplement plan paying second, and then you pay third, if anything. So you have original Medicare Parts A and B paying first with a supplemental secondary plan, which through UC would be one of our Anthem Blue Cross Medicare supplement plans like the UC Medicare PPO. So that's one way to go. The other way to go is to give your Medicare away. It's to sign away your Medicare benefits to a private insurance company. If you sign over your Medicare benefits to a private company, that's called a Medicare Advantage arrangement. And if you're in a Medicare Advantage plan, that plan replaces Medicare. You don't have Medicare. Medicare pays the plan to cover you and then washes their hands of you and doesn't pay your claims. So you're relying upon the private insurance plan, the Medicare Advantage plan, to pay your claims. Okay? So the downside to that is that the Advantage plan is free to require prior authorization for all kinds of things. But the advantage in Medicare Advantage is usually, but not always, lower premiums. So remember, you don't really have a choice here except during open enrollment. You're either going to keep your Medicare because you're in an Anthem Blue Shield of California PPO, then you get Medicare, and then you go to the Anthem PPO secondary to Medicare. That's the partner plan, UC Medicare PPO. Or you're in an HMO, you're in Kaiser, or you're in HealthNet, and you're going to go to their respective Medicare Advantage plans. This is not a choice except during open enrollment, really. But those are the two ways you can coordinate with Medicare. You can either keep it or you can give it away. Now let's focus on those Medicare Advantage plans since most people have HMOs here. Well, if you're enrolled in an HMO when you retire and get Medicare, or if you retire past 65, then you are required to go to your Medicare partner plan. You're required to sign over your Medicare benefits. You must give your Medicare away to the Medicare Advantage plan. You'll sign over your plan. Yeah, sorry. You'll sign over your Medicare benefits to the plan by form. Now, this may be a paper form if you are retiring past 65, or you may be able to do an interactive form on UC Raise if you turn 65 after you retire. Either way, there's a form involved. Either way, it's not necessarily simple. Please call us, okay? Nick and I deal with Medicare all the time. You only turn 65 once. You usually only retire once. Let us help you deal with this stuff. Let us help you deal with the paperwork. Now, if you have a Medicare Advantage plan, you cannot use Medicare separately from the plan, okay? So that means that you're going to have to use the plan for everything as if Medicare doesn't exist. And remember the partner plans. If you're in HealthNet and you have the UC Blue and Gold HMO and you become eligible for Medicare and you're covered by our retirement system, you're going to go to the partner plan UC Medicare Choice, which is a United Healthcare Medicare Advantage PPO plan. And that's an upgrade for you because you're going to go from an HMO, a prepaid medical plan, to actual health insurance. United Healthcare, with this plan, does not prepay anyone to take care of you. In fact, they'll let you go to any Medicare provider who will see you. Not all doctors will take Medicare Advantage plans because of the prior authorization requirements, but you'll have access to probably 90% of the doctors in the United States. So it is an upgrade, and you'll still have HealthNet style copayments for the most part. If you're in Kaiser and you coordinate with Medicare, we're going to put you in Kaiser Senior Advantage, and you still just use Kaiser like always, but there are some enhanced benefits like much better hearing aid benefits when you have Kaiser Senior Advantage. And both of these Advantage plans, as a way to attract a healthier membership, will give you access to free fitness clubs, which our other Medicare supplement plans will not. Speaking of our Medicare supplement plans, let's talk about the Medicare supplements. If you have a PPO plan and you retire with Medicare, you're going to go to the UC Medicare PPO. Medicare is going to pay first. Blue Cross is going to pay second. You're going to pay third, if anything. The nice thing about having a PPO and going to a Medicare supplement plan is that you get to keep your Medicare that you paid so many taxes for. Medicare pays first, Blue Cross pays second. So Medicare is primary, Blue Cross is secondary, and then you pay third, if anything. Now, Medicare won't know that it's primary in this situation when you retire unless you tell Medicare. And here's how you tell Medicare. You don't need to do this if you're in an HMO. But if you're in a PPO plan and you go to the UC Medicare PPO plan and Medicare's paying second when you retire, then Medicare won't know that you've retired unless you tell them. So you'd need to call Medicare's Coordination of Benefits call center at this phone number, 855-798-2627. Call us 3 months before you turn 65. We will remind you of such things. Call us if you. But this isn't necessary if you turn 65 after you retire. But if you're going to retire past 65 and you're in a PPO plan and you're going to the UC Medicare PPO, Medicare is supposed to pay first, but they will not pay first unless they know they're primary. And the way they know that they're primary is that you call the Medicare Coordination of Benefits call center and you say, hey, I retired. My last day I'll pay was June 29th. Or you call them up and say, hey, my spouse retired. I'm no longer covered by active employee health insurance. My spouse's last day was June 29th. That kind of thing is what you would do to let Medicare know that the next day, Medicare is your primary insurance. And the biggest advantage to having this kind of coverage is that Medicare rarely requires prior authorization. As I mentioned, it's pretty much for certain infusions and certain durable medical equipment, like maybe a power wheelchair, but not much else. Now, don't get me wrong. Lately, Medicare has been experimenting with additional prior authorization requirements in 5 other states, not California, thank goodness. So, for one of the big advantages of this kind of coverage is that the doctors who are treating you control your health care, not some panel of doctors at a private insurance company who have never seen you. And prior authorization means you could have your coverage delayed. You could have your coverage denied. You could be kicked out of the hospital early. You could be kicked out of the skilled nursing facility early. You might not be able to get that proton beam radiation because the insurance company wants to pay for something cheaper and less precise. That kind of thing. Now, if you're in this kind of plan where Medicare pays first, somebody else pays second, Medicare's paying first, so you need to use Medicare providers. Okay, so Medicare.gov is where you would look for doctors and chiropractors and physical therapists and durable medical equipment suppliers for your CPAP machine. You'll control where you go, but you got to use Medicare providers, and that's where you find them is on Medicare.gov. And what you'll find is that roughly 99% of doctors in the US are Medicare. Only 1.2% of physicians have opted out of Medicare. We're talking about non-pediatrician physicians, okay? Non-pediatric physicians, only 1.2% have opted out. Don't get me wrong, not everybody's accepting new Medicare patients, okay? For like 10 years, Sutter affiliated primary care physicians in the Davis, Sacramento area have not been accepting new Medicare patients. They'll take new Medicare Advantage patients, but not Medicare patients. And it's only an issue if they're new, if it's a new doctor. If you have a Sutter primary care physician and you retire with this kind of plan, they're going to keep you. But when that PCP retires, you might have a problem. So heads up. Just to make the point that this is the first year, and I'm still getting used to this. This is the first year that we will have mixed Medicare families where some family members have Blue Cross and some family members have Blue Shield. In California, Blue Cross and Blue Shield are separate companies. In a lot of other states, Blue Cross and Blue Shield are the same company. But in California, Blue Cross and Blue Shield are separate. So on our left is the non-Medicare UC Care, where you would have Blue Shield. And on our right is the Medicare Partner Plan, UC Medicare PPO, through Anthem Blue Cross. It's taking me some getting used to. Now remember, if you are going to retire past Medicare age, or if you are retired and you become eligible for Medicare, you've got to coordinate your benefits with this plan also by form. And again, if you are retiring past 65, this is going to be a paper form. If you are turning 65 after you retire, it's going to be an interactive form on the UC Raise website. But either way, Nick and I will help you with the process. Or you might have the Health Savings PPO plan. Remember, I mentioned that the Health Savings Plus PPO plan is not compatible with Medicare, and it has no partner plan. It has no Medicare partner plan because it's affiliated with an HSA. It's designed to be compatible with a health savings account. So that means that you can keep it into retirement and you can choose it during open enrollment when you're retired until or unless you or a covered family member have Medicare. Because this plan is not compatible with Medicare, once you're retired and have Medicare or anybody in the family has Medicare, you're going to have to change plans. And it's like we have to give you your own personal open enrollment to choose any plan you want. Okay? So heads up there. And the whole reason that it's not compatible with Medicare plans is that the IRS will only let you contribute to an HSA if you are only covered by a HSA compatible high deductible medical plan. Medicare's deductibles are too low, so no HSA contributions for people with any part of Medicare. And just be aware that you can't get into this plan mid-year. You can only get into it during open enrollment when you're retired. So I give you that heads up because if you plan on moving after you retire to, let's say you're moving from Sacramento to Chico, California to be near the Sierra Nevada Brewery. You would not be able to choose this plan mid-year, but you could choose it during open enrollment. Now, we talked about Medicare Parts A and B earlier. I wanted to, ease you into this information, but now it's time to talk about Medicare Part D. That's D as in drugs. If you have Medicare Part D, as in drugs, you will know it because you'll see this symbol on one of your ID cards that says Medicare RX. This symbol tells the pharmacy that you have Medicare Part D, as in drugs. I want you to think of Medicare Part D as a way for Medicare to subsidize your health premiums. Okay? It is the outpatient prescription drug benefit under Medicare. But the way it works with our plans is that it really subsidizes our premiums. So you will have Part D, but it's going to be custom UC Part D unless you move out of California and have VA benefits. Okay? So it's custom, very nice Part D plans through UC. Now, I want to mention to you that the prescription drug coverage that you get through UC medical plans, all of the UC employee medical plans, includes what we call creditable prescription drug coverage. Why does this matter? It matters because Medicare will charge you more if you don't have continuous coverage by health insurance that includes creditable prescription drug coverage from age 65 on, or from when you first get Medicare on. Our coverage is considered creditable because all of our plans have drug coverage that is as good as a standard Part D plan or better. Of course, it's better. But all of our plans include creditable drug coverage. So that's why you see all that creditable drug coverage language in your open enrollment booklet. And you might be thinking, why are they telling me this? I'm not going to be 65 for 30 years. Well, now you know. UC is telling you your coverage is creditable, so it satisfies Medicare's requirements so that you don't have late and you retire past age 65 and you enroll in a Medicare Part D drug plan. If that plan cannot tell that you were continuously covered by health insurance through active employment and that you had creditable prescription drug coverage that was at least as good as Part D, that new Part D plan is going to have to ask you about it. And the way they ask you about it, this is why I have the red warning symbol here, is that they're going to send you a letter that says, we're going to have to charge you a late enrollment penalty unless you were covered by creditable prescription drug coverage from age 65 on. And they're going to send you this form, a huge form. Please don't fill out the form. Please call the medical plan. Okay? Let's say you have HealthNet and you retire at age 68. So you had 3 years past age 65 where you did not have Medicare Part D, but you retire from UC so that you get health insurance through UC, and we put you in the UC Medicare Choice Plan through United Healthcare. Well, United Healthcare isn't going to know that you had drug coverage from age 65 to age 68. So United Healthcare is going to have to send you one of these forms and say, hey, we have to charge you a late enrollment penalty unless you had creditable drug coverage. And they're going to send you this form. Don't fill out the form. Call United Healthcare. Tell them, oh, I had HealthNet from age 65 to age 68, and HealthNet is includes creditable prescription drug coverage. That's all you have to do. You don't have to send them copies of your ID card unless you fail to respond, and then you get yourself in trouble. So, important, if you retire past 65 and you see anything in your mail about late enrollment penalties, pay attention. And if you're unsure about what to do, call me, call Nick. We'll figure out what to tell you. Other things to understand about Medicare Part D as in drugs. Well, Medicare Part D, as in drugs, was designed by Congress to pay for outpatient prescription drugs. But it's not designed necessarily to pay for the administration or the injection of those drugs, which makes some things a little bit awkward, okay? For example, Medicare Part D as in drugs might pay for an immunization, but Medicare Part B as in boy might pay for the administration of that immunization by a nurse, right? So it's a little weird. So here's some advice for you. When it comes to vaccinations, if you have a Medicare plan through, well, any Medicare plan, but a plan through UC, hopefully, please do not get your shingles shot at a doctor's office because you'll have to pay up front for it and submit claims for reimbursement, and it's going to be a pain in the neck. Okay? Make your life easy. Get your shingles shot. at a pharmacy that belongs to your plan's network so that you don't pay for it. When it comes to flu and COVID shots, you can technically use either your doctor's office, your primary care physician's office, or your network pharmacy. But those are pretty much the only ones that I'm sure of. Okay. Other than that, check with your plan. Okay. Generally, you're going to want to get your immunizations at a pharmacy so that you don't have to pay up front. The exception is flu and COVID, where you might be able to use your doctor's office. Okay. Something else to know. Something else to know. You might be wondering, do I have to pay per month for Medicare Part D if you're covered by UC? And the answer is no. If you're in our custom plans because you live in California, there is no additional Medicare Part D premium unless you're high income. If you're high income, you pay high income premiums for Part B as in boy and Part D as in drugs. Something else to know is that because Medicare Part D is Medicare paying a private insurance company to cover you for drugs, they're not going to pay more than once per month per person. Well, that complicates or prevents double coverage. So let's say you are retiring from UC and you strategically married a state employee so that you, in your retirement, you'll have access to Medicare, UC, and CalPERS retiree benefits. Well played. Very, very nice. If you can get all three, that's fantastic. But you're going to have to make some choices because you can't have Medicare paying twice to cover anybody. So that's when you're going to want to consult with me. You're going to want to consult with Nick. Call us and we will help you if you have married strategically. Because if you enroll in a non-UC Part D plan or Medicare Advantage plan, then that means Medicare is not going to pay our plans and you're going to lose your UC retiree coverage. Okay? Don't create a conflict. Consult with us so that you can take best advantage of all your options. Now, I mentioned it before. Now let's talk about it in more detail. If you move outside California, you're going to save UC money because UC will not continue to pay for your custom spectacular Medicare plan if you and all covered family members are age 65 or older and have Medicare. Okay? If you move outside California and somebody in the family is under 65 and you're covering them, then you're not going to go to VA benefits. But once all covered family members are 65 and older and have Medicare, then you're going to get local coverage through VA Benefits, which is a giant insurance broker that sells Medicare plans all over the United States. You're going to get your coverage through VA Benefits, and it's going to be an individual policy like anybody could buy in that state. But UC is going to help you pay for it by providing HRA money. A health reimbursement arrangement account will be established for you, and UC will put up to $4,000 per person per year every January into this HRA account. Now, heads up, that $4,000 per person is subject to graduated eligibility. So if you only get 50% of the UC contribution, you're only getting $2,000 per person. And this amount is prorated so that if you move mid-year, like let's say you move halfway through the year, July is when you start to be covered through VA benefits, well, you'll only get half of the HRA for that year. And then the following January, you'll get the full infusion. So UC isn't going to cover you directly, but you're going to have a lot more choices through VA benefits than we could ever offer you. But it is cheaper for us to give you $4,000 per person per month than to cover you directly because, like I said, our plans are really rich and really nice in California, our custom Medicare plans. So this occurs if you change your home address, okay? Home address. If you're going to be a snowbird or, and live on the East Coast during the summer and the West Coast during the winter, or if you're going to live with your, go hang out with your grandkids for a while in one part of the country and California, other parts of the country, just don't change your home address. As long as you don't have Kaiser, our Medicare plans work anywhere in the United States. So if you don't have Kaiser and you have UC Medicare PPO or UC Medicare Choice, you can go to any Medicare provider who will see you. So you can snowbird it all you want, hang out with the grandkids all you want. You can see doctors in Portland, Maine, and Portland, Oregon, and Sacramento all at the same time if you want. But if you change your home address to something that's outside California, we're going to send you to VA benefits. once all covered family members have Medicare. You can have a mailing address anywhere. It's the home address that triggers via benefits. And keep in mind, Medicare doesn't pay for teeth or glasses or any of that. This only affects your medical plan. So UC is only going to change your medical plan to via benefits if you move out of state. It does not affect your dental, vision, or legal coverage, etc. Okay? Just medical. And Nick and I are here to help you with any transitions. We'll help you understand how the HRA is going to work and how much you'll get and the options that you'll have through via benefits. You're going to use that HRA money if you go to via benefits to reimburse yourself for mainly premiums. That's what it's designed for. You're going to use it to reimburse yourself, not to pay. It's a reimbursement account. You're going to use it to reimburse yourself for what you pay for Medicare, what you pay for Medigap, Medicare Part D premiums, Medicare Advantage premiums, whatever you choose in that other state. You're going to have real world Medicare plans, but UC is going to help you pay for them. You can reimburse yourself out of that HRA, hopefully automatically every month by setting things up with via benefits. And the reason we establish an HRA rather than just add the money to your pension check, this way it's pre-tax. You're not going to pay for that HRA money tax-wise. Now, I want to warn you that if you do have Kaiser and you're going to be outside the Kaiser service area for more than 2 months, you're going to need to change medical plans. Nick and I will help you with that. But if you're going to move out of state, well, you want to give us at least 2 months lead time because Kaiser is an HMO. It's a prepaid medical plan. Kaiser is prepaying the Permanente Medical Group of Northern California to take care of you, or Southern California if you live down south. You're not really covered outside the Permanente Medical Group except for urgent and emergent care. So you need to, change plans, especially if you're going to go to via benefits. Give us a couple of months lead time before you move, and we will help you. Now, if you don't have Kaiser and you have the UC Medicare PPO or you have the UC Medicare Choice Plan, you don't need to tell us anything in advance. Just move to wherever you're moving out of state, and we'll help you. After you get there, call us and we'll help you with the via benefits transition. I'll tell you that many people have told me that they're going to move, and then they don't. Then they end up waiting 6 months and then they move. Escrow falls through, whatever it is. So if you have the UC Medicare PPO or UC Medicare Choice Plan, no need to do it in advance. Move, set up your computer so that you can do the paperwork, set up your printer, and then call us and we'll help you with the via benefits transition. Again, call us. You're going to hear me say this a million times. Call us, not that we won't respond to your emails, we will, but don't be in a hurry if you email me. If you're in a hurry, you're going to want to call me because that's going to be my priority. Call us 3 months to the month in which you or a covered family member turns 65, or if you are 65 or a family member is 65 or older when you retire, you're going to have to deal with Medicare. Call us 3 months before you retire, and we will help you coordinate Medicare. Then we'll help you enroll too. And then after you get your Medicare card that shows Parts A and B, call us again and we'll help you coordinate Medicare with your UC Health Plan. This flyer that you see on the right-hand side of the screen, this is our detailed contact information. It's on the Healthcare Facilitator Program website when you need it. Give us a call. Now, I'm going to take a sip of my beverage and then we'll talk a little bit about the future. Now, I don't have a crystal ball, but we should all expect healthcare inflation to continue to exceed regular inflation. Healthcare costs continue to rise, resulting in premiums that have continued to rise without stopping for the last long while. So things are going to cost more in the future, right? And we should expect that. But at the same time, as of 2025, fewer and fewer large companies are even offering retiree health coverage. Only 27% of large companies offer any retiree health insurance in 2025. That's down from 32% in 2005. 66% of big companies offered retiree health in 1988. Okay, so you see retiree coverage, it's becoming more and more rare. At the same time, unlike your pension, Once you're vested, you're guaranteed a pension, but UC has never guaranteed health insurance premiums for employees or retirees. And one of the reasons for that is that there is no prepaid trust fund that pays for our insurance. If you are an active employee, your medical plan premiums are paid for by your department. The department that's paying you is also paying for your health insurance. That you might expect. But did you know that retirees, people who are already retired, their premiums are also paid for by your department while you're working? And that's because there is, the UC retirement plan is not paying for retiree health benefits, and there is no prepaid trust fund. It's pay as you go for the University of California. And the way they pay it as we go is that the university assesses your department a campus assessment fee of 2.3% per fiscal year, for fiscal year 2025. Your department is paying a tax, if you will, into the fund that pays for retiree health coverage while you work here. Okay, the people who are already retired are being funded by your department that is trying to get teaching, research, and public service done, and medical care, right? Our departments are paying for our retirees, and they're also using that 2.3% to pay for the healthcare facilitator program. Thank you very much for supporting the healthcare facilitator program, even though you didn't know you were doing that. But having said that, the university absolutely intends to continue retiree health coverage because it is a very, very valuable tool to help us recruit and retain employees. I mean, if we stopped offering retiree health coverage, we would have to pay you more. We certainly don't want to do that. But really, we're one of the last employers to offer a rich retiree health benefit. So it's a very, very valuable advantage that other employers don't offer anymore. That makes it all the more valuable to work for UC. So it's to recruit and retain employees. It's to get the hooks in you and keep you here as long as possible. Also, as a socially responsible institution, the university does not want to add to the problem of the uninsured in the United States. But really, it's to recruit and retain. But there have had to be reductions made over time. After the big financial crisis in 2008, the university assembled a post-employment benefits task force, which had to address shortfalls in UC's funding. I mentioned that the university contribution is not paid for out of a pre-funded trust fund. It's pay as you go. And because it's pay as you go, it is known as an unfunded liability to the university. And back in the day, the government changed it so that retiree health was considered an unfunded liability, and it started affecting our ability to borrow money. It affected our interest rates when we were trying to borrow money for large capital projects. At the same time, that happened right after the big financial crisis in 2008. So the Post-Employment Benefits Task Force had to take measures to reduce the university's costs. So they reduced the UC contribution for retiree health coverage as a percentage of total premiums down to 70% of aggregate medical plan premiums. Okay. At the time, they were paying like 92% of aggregate premiums for retirees with Medicare, and it's something like 86% for employees' premiums. So when I say aggregate medical plan premiums, I mean they take all the people who are covered by, UC Care and Health Net and Kaiser and Health Savings Plus. They take all those rates for all those people, and they figure out what is 70% of that number. That's the maximum UC contribution toward retiree health coverage. So when you're a retiree, if you get, let's say, 100% of the UC contribution, you're really getting 100% of 70% of the contribution, the UC contribution, because the 70% is what's used to determine the maximum UC contribution. If you're an employee, it's over 80%. But if you're a retiree, UC is basing its maximum on 70% of aggregate medical plan premiums, and is that same three rules that we talked about at the beginning of the presentation for those who joined the retirement plan July 1st, 2013. I'm seeing my internet connection is unstable, so I'm going to go off video for a minute. Let's see. More recently, but still in the past, the university assembled a retiree health benefits working group that was designed to come up with contingency plans for ways that they might address future budget crises if needed. And they were supposed to come up with ways to reduce UC's costs without affecting retirees as much as possible. And then this working group got expanded to review coverage for all employees, not just retirees. And then that slowed it way down, and nothing has happened in years with the Retiree Health Benefits Working Group. I don't know what's going on with it. I haven't heard anything recently. But the idea is the university is trying to come up with contingency plans if there's another budget crisis that will, uh, so that they can selectively, carefully reduce costs while impacting people as little as possible. So I don't have a crystal ball. I don't know what's going to happen in the future, but you never know when there's going to be another budget crisis. And, who knows? At the same time, premiums continue to rise, so UC has to have contingency plans in place. But I personally am not worried about UC not covering me in my retirement, which will be July 1st, 2033. That's my plan. I am absolutely expecting retiree health coverage. Now, as we conclude, I want to make a special shout out to people who are happy for you, but I want to give you some pointers, and some of these pointers will apply to everybody, but most of them are specifically tailored. Some of them are specifically tailored to the July 1 retirees. Remember, if you're in the 1976 tier and you want to take advantage of that inactive COLA, you need to retire on July 1st, and you need to have at least a one business day break in service between July 1st and your last day on pay. So you're going to want to separate on June 29th and then retire July 1st. Again, if you're not in the 1976 tier, tune that part out. But if you're going to retire on July 1st, you want to apply 90 days prior. The earliest you can initiate and elect retirement is 90 days prior on UC Raise. So you're going to want to take action on April 1st and be some of the first people in line to apply for retirement for July 1st, because that's a big bottleneck for the university. UC never wanted everybody to retire at the same time, but we figured out that there's this loophole in the 1976 tier that allows people to take advantage of the inactive COLA. And we can't not tell people about that. That wouldn't be fair for some people to take advantage and other people not. So we just let everybody take advantage. And believe me, that loophole was written out of the newer retirement plans so that in the future, we don't have everybody retiring at the same time. But because so many people are retiring at the same time, if you're going to retire July 1st, please try to do your initiate and elect retirement action on UC Raise on April 1st. Now, as you go through retirement, you're going to want to submit everything through UC Raise. But I will say that when it comes to retiree health paperwork for people who are coordinating with Medicare, retiree health forms are best faxed. They will take them as uploads, but UC Raise isn't really designed to handle retiree health forms, so fax is often easier for the RASC when it comes to the retiree health paperwork. Everything else, you should be using UC Raise and uploading. Remember, UC Davis pays for an extra month of coverage when you retire, so your UC Davis coverage isn't going to end July 1st when you retire July 1st. It's going to end July 31st. And if you are age 65 or older or otherwise eligible for Medicare, you are going to need Medicare Part B to begin August 1st because of that 1 month delay. So August 1st is the first day you'll have coverage through the retirement system. That's when we want you to have Medicare. Therefore, the earliest you can apply for Medicare and get it if you're past 65, the earliest you can apply for Medicare and get Medicare on August 1st is May 1st. So don't everybody call me on May 1st, but call me and Nick late April, early May, something like that, so that we can get you hooked up with Medicare Part B on August 1st. If your birthday is close, if your 65th birthday is close to your retirement date, call us, consult with us, because it's even trickier. Now, I want to warn you about some things. If you are eligible for Medicare, or you have a family member who's eligible for Medicare. UC Ray's retirement process is not smart enough to account for future enrollments in Medicare. So your personal retirement profile is going to misquote your medical insurance premiums. It's not going to take into account your Medicare enrollments. Similarly, if you expect to be eligible for retiree health coverage and you get a final confirmation letter from UC Ray's that doesn't have your health insurance quite right, or it doesn't have your premium or your plan quite right because you have Medicare or your family member has Medicare, that is normal. But warning, if your final confirmation letter says nothing about health insurance, be worried and contact the RASC. The final confirmation letter, if you are eligible for retiree health coverage, it needs to say something to that effect, even if it misquotes the amount that you'll pay because of Medicare. Okay, so there's my special shout out for the July 1 retirees. Congratulations. That concludes this part of the presentation. Of course, you can always contact your healthcare facilitators. We troubleshoot the use of UC medical plans. We help you with the Medicare enrollment and coordination. We provide education and assistance. There are only two of us. It's Nick and I, right? But please give us a call. We will help you through Medicare enrollment and coordination. And we serve employees and retirees. Again, we are greatly outnumbered. We serve the largest retiree health population among UC retirees. Even UCLA has fewer retirees with health benefits than UC Davis does. That must tell you that UC Davis is a better place to work than UCLA. But we also are the second largest employee population, and we help employees and retirees. So thank you for your patience. If you don't catch us live, leave us a message. We'll call you back as soon as we can. If you email us, we will get back to you as soon as we can, especially during open enrollment. That's when we're really, really busy because we're the two people at UC Davis who specialize in health plans. And now I want to, before I start answering Q&A questions, which are going to be brought to me by Nick, I need to shut my blinds. I'm getting the sun in my eyes here. I'll be right back.
Okay, well, Garen's doing that. I just want to say thank you to both him and Nick. And Nick's big job's coming up now as he moderates all the questions, which I see we have quite a few in there. But I know he's also been answering a lot in the background. So thanks, Nick. And once again, if you forget, like, what is their department? Where are they in benefits? You can always call the retiree center. We can give you their information. We work in tandem a lot. Like yesterday, I was on the phone with Nick trying to help a retiree understand something. So we are always, we work for alumni and affiliate relations. That's part of our team, but Nick and Garen and Dawn and Fidelity people you're going to meet next week, they're sort of our unofficial team. We work really closely together for our employees and our retirees. So once again, we are always a resource, and I will go through the chat and look at all the links Nick has sent to include those in the email that I send out next week with the recording so that you'll also have that, but you'll also, I'll get this slide presentation as well. Anyway, Nick, let's get started.
All right. We'll get started. Thank you all for attending, and also thank you for your patience. There are lots of questions that I intentionally didn't answer because I knew Garen was going to answer live, and it would be best for everybody in this meeting to hear. So thank you for your patience. I see you guys. Let's get started. This is a question that's been asked a couple of times. What do we have health coverage if we move to another country?
Aha. Okay. Obviously, an HMO isn't going to work, but UC offers two PPO plans that would be available outside the United States. Medicare doesn't pay outside the United States, so Medicare plans are not an option if you're going to retire to another country. But you could be in the Health Savings Plus plan, or you could be in the UC Care plan if you reside outside the United States. Now, both of those plans are Blue Shield PPOs, and Blue Shield belongs to the Blue Cross Blue Shield Association of America, and they actually have a preferred provider network outside the United States in something like 190 countries around the world. if you reside outside the United States and you're going to use our coverage, understand that you don't have to use a preferred provider, but if you can, some of them can bill US insurance these days. Not everybody can do it, but there are some preferred providers outside the United States who can bill US insurance so that you don't have to pay upfront and submit claims for reimbursement for everything. But I will say that if you're going to have a PPO through UC and do any traveling outside the United States or live outside the United States, there's a phone number on your Blue Shield or Blue Cross ID card for what we call Blue Card, which is the Blue Cross Blue Shield Global Core Network.
Oh, you cut out, Garen.
How about now?
Good.
There's a phone number for the international assistance that you can use that will minimize the amount of paying up front that you would have to do if you do need to use UC coverage in a foreign country. All right, next question.
This is a question about life insurance. When it ends in retirement, what happens to the contributions?
Oh, wow, that's a great question. Now, I am no expert on life insurance. I haven't been a benefits rep for more than 22 years. But my understanding is that UC's life insurance is term life insurance. It is not group or whole life insurance. So there is no cash value to it. So that's why it's inexpensive, as I understand it. So, long story short, what you've paid in just disappears if you don't use it. And I hope you never have to use it.
Would that be the same for the FSA? The remaining funds for the FSA?
Okay, so I'm not an expert on the FSA, but my understanding is that if you're going to contribute to the Health Flexible Spending Account in your last year of employment, you need to be careful because you need to make sure that you have accrued enough eligible healthcare expenses to claim back anything that you put in. Because let's say you retire July 1, that means you're only going to contribute half a year to your health FSA. Well, if you made a pledge of $2,000, well, then you better make sure you have $1,000 worth of eligible expenses that you can claim to get that money back because FSA money is use it or lose it. There is a way to continue FSA temporarily through COBRA continuation, but you don't want to use COBRA continuation. Then you'd be paying into the FSA on an after-tax basis, which defeats the whole purpose of the FSA to help you save money on taxes. So again, make sure you have enough eligible expenses to claim back whatever you're going to put in the half year or whatever it is that you're going to pay in before you retire. I hope that helps with the question. For additional FSA questions, I would encourage you to reach out to the benefits office or WEX, the administrator of our health FSA.
Here's a question about CalPERS years of service and how that works with reciprocity. This member had 8.5 years with CalPERS. So does that count towards service credit?
I'm afraid it does not for health insurance purposes. I mean, I know that you can retire from both systems on the same day and get a pension from both systems, but CalPERS service credit does not count towards UC retiree health service credit eligibility or retiree health eligibility is what I'm trying to say. Sorry for the bad news.
Are medical plan options available for retiree plus families? Oh, you cut out. Yes, and the answer is yes.
Yeah, the answer is yes, if you can hear me. I mean, we cover spouses and kids and grandkids and disabled dependents and domestic partners, etc. Same as when you're an employee.
Here's a question. This employee plans to retire, travel outside after they retire. Can they suspend their health coverage and just maintain travel insurance, and then come back to the UC health plan once they return to the United States?
Well, that's a really interesting question. I've never been asked that before. I don't know enough about travel insurance to say whether that's a good idea. You would definitely have to consult with the travel insurance broker. I will add that you can buy UC negotiated travel insurance if you're going to be retired and traveling. You don't have to be working, you don't have to be on UC business to use UC travel policies. If you're interested in that, do a Google search for UCOP, UCOP Risk Services. The UCOP Risk Services website, if you click on personal travel policies, that'll tell you more. But as for whether you can suspend your coverage through,
Oh, wait.
did I cut out again?
Yeah, you're good now.
Okay. You can absolutely suspend your UC retiree medical and or dental coverage and come back to it during open enrollment, or you can prove to us that you've lost other coverage elsewhere involuntarily. So yes, you can suspend your UC medical and or dental, whether or not it's a good idea.
Uh, this is a good one. My spouse and I both work for UC. Health plan is deducted from my paycheck. If I retire, but my spouse continues to work for UC, what's the best way to handle the health plan?
Oh, that is not a simple question. And the reason is if you're eligible for Medicare and you want to take advantage of the superior Medicare plans offered by you, the retirement system, then you might go that way. But if your goal is to save money on premiums, then you might uh, switch to coverage through the employee who continues to work. Now, we have been told that UC Path will allow two married employees to pick up coverage through the employee who continues to work. So you can do that, but I would say if you're non-Medicare, that would make a lot of sense. But if you have Medicare, then you won't be able to take advantage of Medicare while covered as an active employee. On the flip side, if you have Medicare, but you're super high income and your Medicare premiums are through the roof because you're so high income and you don't want to pay those Medicare premiums, then maybe you would want to be covered by your active employee spouse. So there's no simple.
Oh, wait. Yes, there is no simple answer to that question. But you can always call either Garen or I, and we can run the numbers and put our heads together. I have another question. As an employee, I currently live outside of the Kaiser service area, but still receive service. Or still have Kaiser. What happens when I retire?
Oh my goodness. If you're retired, then you can no longer use a work address to qualify for Kaiser. So you'll have to change from Kaiser to most likely health insurance because if Kaiser isn't available, Health Net, the HMO, isn't going to be available either. So you'll be looking at the UC Care plan if you change plans as a retiree. Now, during open enrollment, you could switch to the Health Savings Plus plan through Blue Shield, but if you change as a retiree mid-year, it's going to have to be the Blue Shield plan called UC Care.
Here, your HSA money is available to use in retirement, correct? You just can't contribute.
Well, you definitely can contribute, just not out of your pension check if you're a retiree in the Health Savings Plus plan and you want to contribute to your HSA. You would transfer money using the Health Equity website from a checking or savings account to your HSA. Now you might be thinking, oh, well, that's after tax. That defeats the purpose. No, it doesn't. Because if you transfer money to your HSA using the Health Equity website, at the end of the year, Health Equity will make anything you put in there federally pre-tax. So you can contribute to your HSA after you retire. Now, in general, HSA money is nice to have because you didn't pay federal taxes on what you put in, on any earnings, or for you wouldn't pay taxes on eligible healthcare expenses. But once you're age 65 with an HSA, you can actually take the HSA money out at any time once you're age 65 for any reason, and it's taxed as normal income the same way it would be if you were taking a distribution from your 403b or an IRA. But the big advantage to the HSA is that triple federal tax advantage if you take distributions for eligible healthcare expenses. But you could use it to reimburse yourself for Medicare Part B premiums, dental work, prescription drug co-payments, eligible healthcare expenses with no federal tax hit.
If I currently have UC Blue and Gold Health Net when I retire, can I choose UC Medicare PPO, the partner plan of Anthem Blue Cross for retirement, and not the HMO?
I'm sorry, you cannot. Remember, you don't have a choice. You got to go to your Medicare partner plan. You would have to strategically change using open enrollment before retirement or after retirement to get into the UC Medicare PPO. If you were to change to the UC Care or Health Savings Plus plans prior to retirement, then when you retire, you get UC Medicare PPO when you get Medicare. Or you could retire, go to the UC Medicare Choice plan if you have Medicare, because that's the partner plan. Because UC Medicare Choice is the partner plan to HealthNet. And then during open enrollment, the open enrollment after you retire, you could switch to the UC Medicare PPO.
The PPO Medicare plan sounds better than the Advantage plan. What is the disadvantage of a PPO? The expense?
Okay, so if we're comparing UC Medicare PPO and UC Medicare Choice, one is a Medicare supplement, the other is a Medicare Advantage plan. They both have strengths and weaknesses for sure, and they're both better than their non-Medicare partner plans, their non-Medicare counterparts. So they're both an upgrade. But advantages of the UC Medicare PPO, the Medicare supplement plan, number one, you pay less for most medical care, and your providers don't have to get prior authorization hardly at all when you get that care. That's the biggest attraction there. You also have better hearing aid coverage by a long shot with the UC Medicare PPO plan. If we're talking about the UC Medicare Choice plan, the Medicare Advantage plan through United Healthcare, that plan's advantages are that let's say you go to, I didn't get into a lot of detail about these plans, and let me just pause for a moment and say, if you want to know a lot more about the Medicare plans, I don't talk to employees about it in detail, but I have retiree presentations where I do. If you go to our Healthcare Facilitator Program website and you click on presentations for retirees, you'll get a lot more information in detail with charts about all the Medicare plans. But I don't want to give you a headache, but the Medicare Advantage plan through United Healthcare, an advantage of that plan is free fitness clubs. Also, you can see non-Medicare mental health providers without being balance billed, which is nice, unlike the other plan. I think the plan will still provide you with TV dinners for a certain number of weeks after you've been discharged from the hospital. Not that anybody gets very excited about that. Can you think of anything else, Nick?
How about Sutter Health?
I thought of something. Well, thank you. Thank you, Nick. First of all, I thought of foot orthotics. Medicare does not cover foot orthotics unless you have a diagnosis of diabetes. UC Medicare Choice, United Healthcare will cover foot orthotics even if you don't have diabetes. And then Nick brought up Sutter. So I mentioned this briefly, but let me try to flesh it out a little more. I warned you that Sutter primary care physicians in the Davis-Sacramento area have not been accepting Medicare patients for something like 10 years. And the reason they do that is that, when they get busy, it's easier for them to turn away Medicare patients than regular patients, or than non-Medicare patients. Because with Medicare, they can just stop taking patients. But with Medicare Advantage, I asked Sutter about this, and they said it's really hard for them to stop taking Medicare Advantage patients because they contract with a bunch of Medicare Advantage plans, and they would have to contract with each plan to stop taking Medicare Advantage patients. So that's why they're not accepting new Medicare patients. And remember, this is just primary care physicians, not specialists. The primary care physicians at Sutter in the area are not accepting new Medicare patients, but they are accepting new Medicare Advantage patients. So I have had retirees strategically switch from UC Medicare PPO to UC Medicare Choice, pick up a Sutter primary care physician, and then the following open enrollment, switch back to the UC Medicare PPO. So that is an advantage of the Medicare Choice plan. Sutter patients, Sutter primary care physicians will take new Medicare patients. So it comes up when people's doctors are of retirement age and they retire out from under them, and then they no longer have a Sutter primary care physician. Hopefully that is useful information to some of you.
Are the health premiums pre-tax?
Oh, I'm sorry, but no. TIP, the Tax Savings on Insurance Premiums program, is not available to retirees, and there's no way for retirees to pay their premiums pre-tax, as I understand it.
Okay. This is more of a retirement question, but you may know. Plan to retire July 1st, 2026, but have previously planned vacations. Is it possible to pre-fill out retirement forms and delay submission until April 1st? Same with Medicare coordination.
Okay, I'm not an expert on how you retire, but the impression that I've been given by people like Don Goldberg that will be speaking to you in this series is that even if you can do paperwork, in paper, you wouldn't want to do that because it
Oh,
is available on the internet, and the internet is worldwide. So unless you have no access to the internet, I would not do paper. But you could contact the RASC and ask about it. But if I was you, if I'm living it up in Tuscany, I would jump on a laptop, jump on the internet on April 1st, and do the elect and initiate retirement from there. That's how I would do it.
And Garen, I'm just going to add a couple things. So you can't start also the submission in UC Rays at like on April 1st and save it and come back. You have to go through the first process, then they'll tell you 5 to 7 days, then they'll send you an email, then you have to go back in. But there is no way for you to actually like save what you've done. So it's not like the greatest system in the world, but it's improved greatly and it's way better than doing mail.
Thanks, Julia. Okay, I will keep taking questions till noon.
if we
Try
are
to
not
stump me, Nick. Try to stump me.
if we're not in the pension retirement plan and we work for 10 plus years, are we still eligible for healthcare benefits?
Okay, I don't know anybody who has done this, but it is my understanding that if you are in the Savings Choice program, that if you have at least 10 years of service credit and you meet the age requirements, that you would be eligible for use.
Oh, wait 1 second, Karen.
Am I cutting out?
Yeah, now you're good.
Okay, well, you have a major obstacle if you don't get a pension from UC, and that is how are you going to pay for your medical insurance premiums? Because UC isn't paying you a monthly pension, there's nothing to deduct from, which means that you would have to be on top of your manual monthly premium process. So, so I think the answer is yes, but.
This one was addressed, but maybe we can talk about it again. I'll retire on 7/1/26, and I have not signed up for Medicare yet. Should I sign up for Medicare in the coming days? Will there be a penalty?
Okay, well, there shouldn't be a penalty as long as you were continuously covered by health insurance through active employment. And again, you need to be calling me, you need to be calling Nick to enroll in Medicare. I didn't get into it, but we have to sign off on a form that proves that we've been covering you so that you can get into Medicare without a late enrollment penalty. It's almost like having a get out of jail free card for Medicare. Now, having said that, if you don't have Medicare Part A, then that's going to put you at a disadvantage when you go to retire. Now, you may strategically have avoided Medicare Part A and B because you're in a plan, an HSA compatible plan, and you want to be able to contribute to your HSA. Well, I understand that, but when you retire, you're going to have to get Medicare. When you apply for Medicare Part A, Social Security is going to make your Part A retro 6 months if it's been more than 6 months since you turned 65. So you kind of have to be careful with this. If you are in the Health Savings Plus plan and you want to contribute as much as you can contribute to the HSA and you're retiring past 65, I would say call us and we'll talk about enrolling you in Medicare as quickly as possible in the month of July. But if you aren't worried about maxing out your HSA contributions in 2025, you can pretty much enroll in Medicare Part A anytime you want. So if you don't have the Health Savings Plus plan, and you didn't contribute the max to the HSA last year with the UC Health Savings Plan, then you can enroll in Medicare Part A anytime by calling Social Security. You might also be able to enroll in Medicare Part A between January 1st and March 31st using the Social Security website, because that is the Medicare general enrollment period. So, number one thing to take away from this is to call us. We'll put our heads together and help you decide what the best strategy is. But you really want to have Medicare Part A because having Medicare Part A will literally make it easier for you to get Part B as you retire. So you might want to call Social Security if you're not contributing to a health savings account. Get Part A now. Most people who work past age 65 and are not contributing to an HSA already have Medicare Part A if they're working past 65, because Part A is free if you paid into Social Security for at least 10 years. But not only is it free, it could save you money as your secondary hospital insurance. And it literally makes it easier for you to get Part B as you retire. I hope that made sense. I know what I meant.
Do you have an online calendar tool where we can make appointments with you, or should we just email you?
The answer is no. We don't have an online appointment feature, and I don't intend to add one because uh, appointments take more time in my day than simply taking phone calls. Nick and I can take a lot more phone calls in a day if we don't have pre-scheduled appointments because we can take call after call after call and we can return calls as quickly as possible because we're not tied up with a pre-scheduled appointment. That is not to say that we won't make an appointment for you. If you really want an appointment, you can have one. You can come see us at the at the Administrative Services West Building in South Davis on Research Park Drive. We're at 1333 Research Park Drive in South Davis. If you want to come see us by appointment, don't just show up though, because this building does not always have a receptionist. We might not know you're here, but we can also make Zoom appointments. We can do three-way calls. So we are open to appointments, but I mean, we minimize them because we can help a lot more people in the same day by not tying up our calendars with pre-scheduled appointments.
If I separate, not retire, when do benefits end and COBRA begin?
I would expect your employee coverage to end at the end of the month in which you terminate employment. So let's say you've had enough today, January 16th, and you quit and you don't come back to work tomorrow. Your health coverage will.
Oh, wait a second.
Can you hear me now?
Yep, you're good
Okay.
now.
So that means your coverage would end January 31st. You would technically have 60 days as of the date you lose coverage to invoke COBRA continuation. So you'd want to reach out to the benefits office, benefits@ucdavis.edu, for assistance getting that going. Or you could just wait for your automatic mailing the Cobra continuation mailing that I told most of you to ignore if you're going to be eligible for retiree health coverage. It's a mailing that comes from a company called WEX, W-E-X. You get a WEX Cobra packet after WEX learns that your coverage will terminate.
I'm turning 60 this year and will have 20 years of service credit by February 2027. Would you advise to wait on retiring on July 1st, or does it matter and retire in February?
Oh man. Uh, I apologize. Would you please repeat that question? I want to make sure I'm not missing any nuance.
Sure. I'm turning 60 this year and will have 20 years of service by 2027 next year. Would you advise to wait on retiring on July 1st, or does it matter and I'll retire in February?
You know, if you're 60, you've maxed out the retirement age factor if you're in the 1976 tier, but you have not maxed out the health insurance. Obviously, you're going to make a bigger pension and you're going to have more of a UC contribution toward health insurance for waiting. But advice is not something you're going to be able to get out of us. We can't give you financial advice. We can't tell you when to retire. That's something that you should do in consultation with your financial planners at Fidelity or wherever you have one. But I mean, strategically, 20 years is better than not having 20 years. But if you don't want to wait, and you get some fraction thereof and you're subject to graduated eligibility, you might pay a little more for health coverage, but then again, you didn't work as long. So what's more valuable to you? I can't tell you what would be more valuable to you.
So, Garen, can I jump in again? So this is also, I mean, this does won't give you the healthcare estimates, but Garen and Nick have a great system for that. But if you really want to see what the advantage is to retiring on July 1st or when you've hit your 20 years, go into your UC Rays and create a retirement estimate. And then you can compare up to 3 estimates at a time and see what's most beneficial for you.
I'm going to give you a heads up about that, though. If you are trying to factor in the inactive COLA and you're in the 1976 tier, the inactive COLA will not be loaded into the UC Rays retirement estimator tool until the very end of March, which means you're going to have to wait for the very end of March or April 1st to run an accurate estimate of a retirement date of July 1st and separation date of June 29th. If you're going to try,
Oh, wait a second.
you lost me again, huh?
Yep, you're back now.
Okay. So sorry. I mean, I'm in an office building that is owned by UC, but my internet connection is unstable. But anyway, uh, the point is, if you're going to run an inactive COLA estimate now before that COLA information is loaded, my understanding is, and you can verify this with the RASC or Don Goldberg, my understanding is that you'd have to manually add 2% to your pension to approximate the more accurate estimate that you would receive if you were to wait until April to run the estimate.
That is correct. And Don went over that in last week's session, and they would be able to find that in the video that was sent out.
I listen when Don speaks. I try to.
This is a good one. I have the HSA Plus plan and turned 65 this year, but do not plan to retire for another 3 years. Should I sign up for Medicare Part A this year?
Well, the answer is no, because if you sign up for any part of Medicare, or if you're covered by health insurance through a spouse that isn't even Medicare, but if it isn't a high deductible HSA compatible plan, then you will not be able to contribute to the HSA. So Medicare Part A's deductible is too low. It will mean that you cannot contribute to the HSA. It means that anything UC puts in the HSA would be taxable to you. So the answer is no if you want to be able to contribute to the HSA. Now, having said that, remember, you're not going to have late enrollment penalties as long as we're covering you with the Health Savings Plus plan from age 65 to age 68. Then the rule of thumb for people who are contributing to an HSA before they retire is that if you're eligible for Medicare, stop contributing to your HSA 6 months prior to retirement so that you don't over contribute to your HSA by having Medicare eligibility. And that works out for people who retire on July 1st, such that you call us and we'll, come up with a plan for you to apply for Medicare Parts A and B in July if your goal is to maximize your HSA contribution the previous year. It's not fun to do it that.
Wait a second, please.
Okay, thank you for the warning. I can't tell.
There you go. You're good now.
Thank you. I can't tell. So anyway, so if you really want to maximize the contributions, you'd have to wait to apply for Medicare if you're a July 1 retiree until July 1, and then real quick apply for Medicare, and then coordinate Medicare with your retiree coverage for August 1. By doing that, if you stopped contributing to your HSA in January, then you would theoretically avoid any conflict with the IRS rules around HSA contributions. I hope that made sense.
If I'm in Kaiser and plan a 3-month trip outside of the US, could I essentially move to the UC Care for those 3 months and then move back to Kaiser? And would I just pay the higher premiums?
The answer is yes. I mean, that's what you're supposed to do. Under our contract with Kaiser, they are not obligated to pay your claims more than 2 months after you've gone out of their service area. So it would be recommended. It's mandatory, really, that you change plans. When you return, you will have the choice to either switch back to Kaiser or remain in a PPO plan.
Do we inform the benefits office if we decide to move out of state, or does it go through UC Raise?
Well, the benefits office doesn't really serve retirees much. Really, you would call Nick or I. If it has anything to do with health insurance, you call us. If it has to do with pension, you would call the RASC. For us, you would call us and we would help you with any life events that have to do with health insurance.
What if I move outside of California prior to 65? Would I still use VIA benefits, or would I receive my supplement according to my group and years of service?
That's a great question. If you're outside California, but you're not old enough for VIA benefits, then you're either going to have Health Savings Plus, or you're going to have UC Care, or if you're covering non-Medicare family members who are younger than you, you might have UC Medicare PPO while they have UC Care. Remember that mixed Medicare family chart I showed you? That's how that kind of thing would come up. But yeah, we have PPOs that work outside California, but we don't send you to VIA benefits until all covered family members are 65 or older and have Medicare if you have a home address that's outside California.
For two 1976 tier UC retiree employees, is it better for each to be on our own retiree health, or for both of us to be on one? Or in other words, is it better to be bundled or unbundled?
Okay, so that's an interesting question. If you are under age 65 and you don't have Medicare, you will notice if you play around with the retiree premium estimator Excel spreadsheet that it would cost you more to be covered together, bundled up under one or the other of you. So you'll actually save money by being unbundled and each carrying your own insurance while you don't have Medicare. Once you are Medicare age, then the premium difference isn't there anymore. So whether you're both covered under one of you or you're each covering yourselves, if you both have Medicare, you're going to be paying the same amount for health insurance either way. However, there is a strategic advantage to being unbundled, and that is you're not going to save any money on premium, but when one of you passes away, then the coverage isn't going to have to be transferred to the other person because they're already going to be covered. So there won't be any hiccups in your eligibility Not that there would be, okay? But when they transfer you as somebody's dependent to coverage under your own record, you'll have to get a new ID card with a new ID number because you are essentially a new member to the health plan. So it's a little awkward. You will avoid that awkwardness by being unbundled and carrying your own insurance if you're both eligible for the same level of benefit. But don't get me wrong, if my wife and I were doing that and one of us was subject to graduated eligibility and only got 80% of the UC contribution, and one of us uh, gets the whole shebang and gets 100% of the UC contribution, I would bundle up under the person with the 100% of the UC contribution. I hope that helps.
If you have Kaiser Senior Advantage, can you use their eye coverage for glasses and VSP for contacts, or do you have to choose just one of them?
They are completely independent of each other, so you can mix and match as you like. How about one more question?
There's a lot of retirement questions. Let's see here. Oh, can I buy service credit to make up for my previous FML leave taken for pregnancy and family care?
Well, that's not really a question for us. That's a question for the RASC, but that is something that you could discuss with the RASC. Obviously, it would be very expensive to do so, but over a certain number of years, it might pay off to buy that service credit, even if you have to pay years of interest on it. Um, but again, you'd have to consult with the RASC. That's not my area. I'm not a pension expert. But that's the last. My stomach is growling, and we're going to present this again at 1 o'clock to the faculty. So I need to have time to feed my belly. So I think it's time to conclude this presentation.
Thanks, Nick. Thanks, Garen. And thanks everybody for attending today. We hope to see you next Friday. We'll be having Fidelity here with, they'll be going over a lot of retirement options and also talking about Social Security. So another informative session next week. So have a great long weekend. And Nick and Garen, I'll see you guys at about 1 or 12:50. See you soon. Thank you so much.